Inside Baltimore Mercy General, a wounded Army lieutenant was dying under the operating lights, while the hospital's most powerful surgeon searched for the bleeding in the wrong place. Everyone was too afraid to stop him. Then Naomi Carter, the quiet nurse everyone ignored, stepped forward and did the one thing no nurse was supposed to do. She stopped the surgeon's hand. The room froze. The monitor screamed, and Naomi said only 7 words. "Move now or he dies in 90 seconds." No one knew how she knew. No one knew why a dying soldier recognized her. But hours later, when a decorated Army officer walked into the hospital and saluted that same nurse, every person in the room finally understood. Naomi Carter had never been ordinary, and what happened inside that hospital would expose a truth no one was ready to face. At 9:17 on a bright Tuesday morning, Naomi Carter heard death before anyone else noticed it. Not the flatline, not the alarms. Those came later when machines got permission to panic. It was smaller than that, a change in breathing, a wet hitch behind the curtain in Trauma Bay 4. The kind of sound a body made when it was still trying to be polite about dying. The trauma floor at Baltimore Mercy General was already moving hard. Wheels rattled over old linoleum. Phones rang from the nurses' station. A printer coughed out discharge papers with a tired mechanical rasp. Somewhere down the hall, a child was crying with that sharp, frightened rhythm that made grown men look at their shoes. Sunlight poured through the tall windows on the east side of the unit, too clean for the place it had entered. It fell across ivy poles, stainless steel trays, scuffed shoes, coffee-stained counters, and the pale blue curtains that separated one human crisis from another. Baltimore Mercy had been built in the 1960s, renovated in pieces, and forgiven by no one. The walls had fresh paint, but the corners still held the smell of bleach, radiator heat, old blood, and burnt coffee. The place never truly got quiet. Even when no one spoke, it breathed through vents, pumps, pagers, and footsteps. Naomi Carter stood at the edge of Bay 4 with a chart in one hand and a roll of medical tape around 2 fingers. She was 31 years old, black, lean, and still in a way that made people mistake her for shy. Her hair was pulled back tight under a Navy surgical cap. Her scrubs were the hospital's required blue, but hers were pressed, clean, and worn without decoration. No bright badge reel, no funny pin, no slogans about coffee or chaos. Her face carried little expression at first glance. That was another thing people mistook. Naomi was not blank. She was listening. The man in Bay 4 was 78, retired steelworker, name of Harold Finch. He had come in after collapsing outside a pharmacy 3 blocks from the harbor. Chest pain, shortness of breath, sweating through a flannel shirt his wife had probably washed 1,000 times. His EKG had not screamed heart attack, so the room had moved on from him. That was how it happened in trauma. The loudest fire got the water. The quiet ones smoldered. A first-year resident named Dr. Patel had glanced at Harold, ordered labs, and disappeared toward the more dramatic case involving a bike courier and a taxi door. Harold's wife, a small woman in a beige coat, sat beside him holding his work-rough hand. Her own fingers looked thin as matchsticks around his. "He's always been stubborn," she said, mostly to herself. "He kept saying he just needed air." Naomi stepped closer. Harold's eyes were closed. His skin had gone from flush to gray around the mouth. His breathing had changed from shallow to uneven. There was a faint pulse fluttering in the hollow of his throat. Not enough. Naomi looked at the monitor. Blood pressure still acceptable. Heart rate elevated, but not dramatic. Oxygen saturation dipping, then correcting, then dipping again. A lazy wave on the screen, pretending everything was fine. She set the chart down. "Mr. Finch," she said. His eyelids twitched. "Harold," his wife looked up. "Is he all right?" Naomi did not answer too quickly. She never did. The truth deserved a full second. "I'm going to sit him forward a little." She raised the bed, slid one hand behind Harold's shoulder, and felt the back of his hospital gown damp with cold sweat. Not the ordinary kind, the body's last-minute weather. She touched 2 fingers to the side of his neck. Thin, fast, wrong. Naomi turned her head toward the hallway. "Dr. Patel?" No response. The hall was full of motion. A tech pushed a cart loaded with supplies. 2 nurses argued quietly over a missing medication. An orderly carried a red biohazard bag at arm's length. Naomi lifted her voice, not loud but sharp enough to cut through the floor. "Dr. Patel, Bay 4, now." The resident appeared halfway down the hall, startled. One glove on, one glove off. "What is it?" "Pressure's about to drop." He frowned at the monitor. "It's 110/70. "It won't be." He blinked at her, impatient. His troponin isn't back yet. Naomi was already moving. Oxygen mask, suction, second IV line. She handed the wife a tissue without looking, because the woman had started crying silently. "Call respiratory," Naomi said. Patel looked annoyed now. "Nurse Carter, I can assess." Harold's monitor gave a single alarm chirp. Then another, the blood pressure cycled again. 82/50, the wife gasped. "Harold?" Naomi leaned toward him. "Stay with me, Mr. Finch." His eyes opened halfway, unfocused, watery. He tried to speak and made only a damp clicking sound. Naomi tilted his head, cleared his airway, and said to Patel, "He needs intervention now." Patel stared at the screen as if it had betrayed him. The floor shifted around them. People noticed alarms. People always noticed alarms. They rushed toward what Naomi had heard 30 seconds earlier. That was her gift, if it could be called that. She heard the body before the machines did. By 9:24, Harold Finch was alive because Naomi Carter had refused to let a quiet collapse remain quiet. Respiratory arrived. Patel caught up. Medications were given. A senior physician was called. The wife stood outside the curtain, clutching her purse with both hands, whispering a prayer into its worn leather corner. When the crisis eased, Patel stepped out of Bay 4 and removed his gloves with unnecessary force. Naomi was documenting the event at the counter. He cleared his throat. "Good catch." She did not look up. "Thank you, doctor." He waited as if there should be more. Maybe gratitude, maybe warmth, maybe a little performance to soften the fact that she had been right. Naomi kept writing. Patel left. Across the nurse's station, Evelyn Brooks watched over the rim of her drugstore reading glasses. Evelyn was 63, white-haired, broad-shouldered, and had worked trauma since before half the hospital staff had learned to spell emergency. She knew who was useful, who was ornamental, and who was dangerous in a crisis. Naomi belonged to the first category. Most people hadn't figured that out yet. Evelyn shuffled over and leaned one hip against the counter. "You know," she said, "one of these days, you could let a doctor discover something first. It would be good for morale." Naomi's mouth moved slightly, not quite a smile. "Wouldn't want to damage morale." "No, we protect fragile things here." Naomi finished typing, saved the note, and reached for the next chart. Evelyn studied her. "You eat today?" "Yes." "What?" "Coffee." "That's a beverage, Carter." "It was hot." "That still doesn't make it breakfast." Naomi flipped the chart open. "Room 7 needs a wound check." Evelyn sighed. "You're a machine." Naomi paused at that, only half a second. Then she said, "Machines don't get tired." Evelyn's face softened, but Naomi had already moved away. She walked the trauma floor the way some people walked a church aisle. Not reverent, not dramatic, aware. She saw the small things. A visitor's shoe untied near a puddle of saline. A surgical tray placed too close to the edge of a counter. A confused patient reaching for his IV line before anyone else noticed his hand moving. She corrected what needed correcting. No speech, no lecture, a strip of tape here, a call light there, a steady hand against a trembling shoulder. To the new interns, Naomi Carter was efficient but unremarkable. To the surgeons, she was another nurse in blue scrubs. To patients, she was often the last calm face they saw before anesthesia, or the first calm face they saw when pain dragged them awake. She never demanded space. She simply occupied the part of the room where mistakes were about to happen. At 10:03, Dr. Victor Langford entered the trauma floor like a man arriving at a room already improved by his presence. Conversations lowered by instinct. Langford was 58, tall, silver-haired, and still handsome in the cold, expensive way of men who had never been required to apologize convincingly. His white coat fit better than anyone else's. His shoes were black, polished, and untouched by whatever the rest of the hospital stepped through. A gold watch showed beneath one cuff when he checked the time, though everyone knew he checked it only when others were watching. He was chief of surgery at Baltimore Mercy General. He did not walk fast. Other people hurried for him. 2 residents trailed him with tablets. A surgical fellow named Dr. Ames kept half a step behind his right shoulder, nodding before Langford finished sentences. They moved toward the central board, where patient names and room numbers glowed in green and white. Langford's eyes swept the floor. Not searching, inspecting. "Why is Bay 2 still occupied?" he asked. Evelyn looked up from the med cart. "Because the patient in Bay 2 is still sick." Langford did not smile. He rarely rewarded plain speech. "Transfer him upstairs." "No bed upstairs." "Find one." Evelyn closed the drawer with her hip. "I'll check the magic closet." One of the residents looked down quickly to hide a grin. Langford's gaze landed on Naomi. "Carter." She turned. "Doctor?" He pointed to the stack of charts at the station. "I need pre-op updates on Keller, Dobbs, and Rosenthal. Not later, now. I'm monitoring Bay 4 post-event and Room 7's wound." That wasn't a negotiation. Naomi held a stare. The hall noise seemed to thin for one beat. Langford was used to eyes dropping. He was used to residents straightening, nurses stepping aside, administrators laughing a little too loudly at dry remarks. He had built a career on accuracy, aggression, and the belief that anyone without a scalpel in hand was a supporting character. Naomi did not challenge him. She also did not shrink. "I'll update the charts," she said. "Good." He started to turn away, then stopped, as if remembering she had briefly presumed to explain her workload. "And Carter?" "Yes, doctor." His voice was calm enough for everyone to hear. "Don't overcomplicate your role. Observation is useful. Imagination is not." A few people looked down. A few pretended not to listen. Evelyn's jaw tightened. Naomi's face did not change. Langford continued, "You're here to keep the charts clean, the rooms stocked, and the patients ready when we need them. Leave the diagnostic theater to physicians." Naomi said nothing. Langford took half a step closer, lowering his voice just enough to make it personal while still making sure it carried. "Update the charts. Don't try to be clever." Then he walked away. The residents followed. A phone rang at the station and kept ringing. Nobody moved for it right away. Naomi picked it up. "Trauma," Carter speaking. Her voice was level. Evelyn watched her from across the desk. Naomi wrote down information from the call, hung up, and reached for the charts Langford had assigned. Her hand was steady, not forced steady, naturally steady. That bothered Evelyn more than anger would have. "You don't have to let him talk to you like that," Evelyn said. Naomi opened the first chart. "He signs my evaluations." "He signs everybody's evaluations. Doesn't make him God." "No." Naomi scanned the lab results. Evelyn lowered her voice. "Then what makes him untouchable?" Naomi looked up at Langford through the glass doors leading towards surgery. He was speaking to an administrator now, one hand tucked in his coat pocket, his expression polished into authority. "People give power to the loudest man in the room," Naomi said. Evelyn waited. Naomi returned to the chart. "Until the room gets quiet." Evelyn stared at her. There were moments, rare and quick, when Naomi said something that did not sound like a nurse from Baltimore Mercy. Not because nurses lacked wisdom. Evelyn would have slapped anyone who suggested that. But Naomi sometimes spoke like someone who had learned human behavior in places where the cost of misunderstanding it was immediate and final. Evelyn had never pressed. Everyone had a locked drawer somewhere. Naomi's seemed deeper than most. At 10:35, the trauma floor hit its first lull of the morning. Not peace, never peace. Just a softer kind of noise. A man with a broken wrist argued with his insurance company over the phone. A teenager with a split lip stared at the floor while his mother filled out paperwork. Harold Finch slept under warm blankets, his wife still holding his hand, both of them gray with relief. Naomi moved from room to room. In Bay 3, she noticed an elderly woman named Mrs. Delgado squinting at the ceiling. "Pain worse?" Naomi asked. Mrs. Delgado shook her head. "Light's too bright." Naomi dimmed it. The woman exhaled. "Thank you, baby." In room 7, Naomi rewrapped a wound on a dock worker's forearm. He tried to joke through the pain. "Looks worse than it is, right?" Naomi looked at the torn flesh, the swelling, the slight redness creeping beyond the marked border. "No," she said. He laughed once, then saw her face and stopped. "I'm going to have the doctor reassess it," she added. Bad? Not if we stay ahead of it. That was Naomi's religion. If she had one, stay ahead of it. Pain, infection, shock, grief, arrogance. Nothing became a disaster all at once. There were always signals. People ignored them because they were inconvenient, embarrassing, or too quiet to compete with ego. Naomi did not ignore quiet things. Near the supply room, she found a new nurse named Tessa Reed fighting with an IV pump. Tessa was 24, red-eyed from night classes, and trying hard not to cry. "It keeps saying occluded," Tessa muttered. Naomi stopped. "Show me." "I already checked the line." "Show me anyway." Tessa swallowed and held it out. Naomi traced the tubing with 2 fingers, found the kink beneath the blanket, and straightened it. The pump resumed with a soft click. Tessa shut her eyes. "I'm sorry." "For what?" "I should have caught that." "You will next time." Tessa looked at her. "Dr. Langford saw me struggling earlier. He asked if I got my license from a vending machine." Naomi's eyes shifted toward the surgery doors, then back. "What did you say?" "Nothing." "That was probably wise." Tessa gave a weak laugh. "Does he talk to everyone like that?" "No," Tessa looked worried. Naomi adjusted the pump. "Only the ones he thinks won't answer." The words hung there. Tessa studied Naomi as if trying to decide whether that was comfort or warning. Before she could ask, Langford's voice cut across the floor. "Carter." Naomi turned. He stood by the central board holding a tablet. His residents clustered around him again. "These pre-op notes are incomplete." Naomi walked over. "Which patient?" "Keller. Surgical consent not confirmed." "It was confirmed at 8:42. His daughter has medical power of attorney. It's in the scanned documents. Second attachment." Langford tapped the screen hard. "I don't see it." Naomi stepped beside him, close enough to smell his aftershave, sharp, expensive, trying to erase the hospital. She reached toward the tablet. He pulled it back slightly. For a moment, the gesture was small enough to deny. Naomi let her hand fall. "Second attachment," she repeated. The fellow, Dr. Ames, leaned in and tapped. The consent appeared. Langford's face did not change, but the skin near his temple tightened. No apology, no acknowledgement. He handed the tablet to Ames. "You should have flagged it more clearly." Naomi said, "I followed protocol." "Protocol is the minimum expected from competent staff." Evelyn from behind the counter muttered, "Here we go." Langford turned his full attention on Naomi now. He seemed almost pleased. He had found a stage, and she had made the mistake of being on it. "You have a habit, Carter, of speaking as though you're part of the clinical decision-making team." Naomi stood still. Around them, the floor continued its work, but slower. People listened while pretending not to. Langford's voice remained smooth. "I appreciate diligence. I don't appreciate nurses inflating routine observations into medical insight." Naomi's gaze did not leave his. Routine observations saved lives. A resident inhaled softly. Langford smiled. It was not friendly. "Do they?" "Yes." "And medical training?" "That helps too." The silence after that was clean and dangerous. Evelyn looked at the ceiling as if asking for strength. Langford stepped closer. He towered over Naomi by several inches, but she did not tilt her head back more than necessary. She had the posture of someone who had stood in front of worse men in worse rooms. "Carter," he said, each syllable clipped, "more intelligence is not required from you. Compliance is." Naomi's fingers curled once against her thigh, then released. Langford continued, "If I need your opinion, I will ask for it. Until then, keep the rooms stocked, the patients prepped, and the charts updated. That is your lane." Naomi said, "Understood." "Good." He turned away, then threw the last line over his shoulder. "And stop hovering around my cases like you're waiting to discover something I missed." That one landed, not on Naomi's face. Her face remained controlled, but Evelyn saw it in her eyes, a door closing somewhere behind them. Langford walked toward surgery, his coat shifting behind him. The residents followed, quiet and relieved not to be her. For several seconds, no one spoke. Then the trauma floor remembered itself. Phones rang, shoes moved, monitors beeped. A patient coughed hard behind a curtain. Naomi picked up a stack of empty syringes left on the counter and dropped them into the Sharps container one by one. Click, click, click. Evelyn came beside her. "You okay?" Naomi did not answer immediately. A long time ago, in a place no one on that floor knew about, she had learned that humiliation was only dangerous if you let it change your breathing. So she kept breathing, slow in, slow out. "I'm working," she said. "That's not what I asked." Naomi looked at her then. For a brief second, the exhaustion showed. Not ordinary tiredness. Something older than her face. A weight that did not belong to a 31-year-old nurse on a Tuesday morning. Then it was gone. "I'm okay." Evelyn didn't believe her. She also knew better than to corner a wounded animal that still had dignity. "Fine," Evelyn said, "but I'm bringing you a sandwich, whether you like it or not." Naomi almost smiled. "Turkey?" "Don't push your luck." Evelyn walked away. Naomi stayed at the counter, hands resting on either side of the chart. Beyond the windows, Baltimore moved under hard sunlight. Ambulances turned in from the street. A bus sighed at the curb. Someone in a gray hoodie crossed the sidewalk with a paper cup in one hand and his shoulders up against the wind, though the sun made the day look warmer than it was. Naomi watched the ambulance bay through the glass. Her reflection stared back faintly from the window. Blue scrubs, hospital badge, Nurse Carter. The name had become ordinary enough to fit in small places. On a badge, on a chart, on a payroll system, on Langford's tongue when he needed someone smaller than himself. Carter. Not commander, not ma'am, not the voice men had once followed through smoke and dust and radio static. Just Carter. Her thumb moved unconsciously over the edge of her badge, where the plastic had cracked near the clip. A memory rose without permission. A different kind of floor under her boots. Grit. Heat. The copper smell of blood made worse by sun-baked metal. Men shouting coordinates. A young soldier's hand gripping her sleeve. Her own voice calm over gunfire, telling someone to breathe, telling someone to hold pressure, telling someone not to die because she had not authorized it. Naomi blinked once. The hospital returned. Bleach, coffee, machines, a nurse calling for transport. She stepped away from the window and went back to work. By late morning, the rhythm sharpened again. A construction worker with a nail through his palm. A woman with a possible stroke whose daughter kept repeating, "She was fine at breakfast." A drunk man in custody shouting that everyone in the hospital was stealing his shoes, though his shoes were still on his feet. Naomi moved through all of it with that same quiet precision. She caught a mislabeled blood tube before it left the unit. She stopped an orderly from transferring the wrong patient to imaging. She noticed that Mrs. Delgado's son kept rubbing his left arm and convinced him to get checked before he collapsed in the waiting room. Each time, the mistake disappeared before it could become visible. And because it disappeared, no one praised her for preventing it. That was the strange cruelty of competence. Disaster avoided looked like nothing. At 11:42, Naomi returned to the nurse's station and found a folded napkin beside her keyboard. Inside was half a turkey sandwich from the cafeteria, wrapped in plastic with a sticky note attached. "Eat it or I'll tell everyone you fainted from hunger." Naomi shook her head once and took a bite standing up. The bread was dry nimus. The turkey was colder than the refrigerator that had held it. The mustard was too sharp. It was the best thing she had tasted all day. She was halfway through when the trauma phone rang. Not the regular line, the red one. Every head on the floor turned. Anolan answered. "Trauma." Her face changed before she spoke again. Naomi saw it, shoulders squared, chin down, eyes fixed. The floor felt the shift. Evelyn grabbed a pen. "ETA?" She listened. "How many?" Another pause. "Age?" The pen stopped moving. Naomi set down the sandwich. Evelyn looked at her. 23-year-old male, military, critical trauma, coming in hot. The room tightened. Langford emerged from the surgery corridor as if summoned by the word critical. His white coat was gone now. Surgical scrubs beneath, sleeves neat, mask loose around his neck. "What do we have?" he asked. Evelyn covered the receiver. "Inbound from medevac transfer. Young soldier, hypotensive, penetrating and blunt trauma. They're not sure what all he's got yet." Langford's eyes sharpened. A hard case. A visible case. the kind that belonged to him. Prep Bay 1, Gitorun. Call blood bank. Get imaging on a standby. I want R2 held open. People moved. Fast. No hesitation now. Tessa ran for warm blankets. Patel grabbed a trauma kit. Ames called upstairs. Evelyn began assigning roles with the clipped authority of someone who had earned the right to be obeyed. Naomi walked to Bay 1. She checked suction, oxygen, monitors, airway cart, blood tubing. She moved quickly, but not rushed. There was a difference. Rushed hands knocked things over. Quick hands made room for life. Langford appeared at the foot of the empty trauma bed. Carter. Naomi looked up. His eyes were bright now, alive with command. I need clean execution. No freelancing, no commentary. We stabilize, identify the primary injury, and move him upstairs. Understood? Naomi held his gaze. Yes, doctor. Outside, faint at first, came the low thud of helicopter blades. The sound rolled over the hospital roof and down through the walls. Thump, thump, thump. The windows trembled lightly in their frames. The trauma floor went quiet in the way battlefields go quiet before the first visible wound arrives. Naomi pulled on fresh gloves. The latex snapped against her wrists. For 1 second, she looked toward the ceiling. Not in prayer, in recognition. That sound had followed her across years, across continents, across every locked door she had built inside herself. Helicopter blades, radio static, a young man bleeding somewhere between command and rescue. Langford stood beside her, confident, impatient, waiting to perform. Naomi stood in blue scrubs under fluorescent light, unseen by the man who would soon need her more than he had ever needed anyone. The helicopter grew louder. Evelyn's voice cut through the unit. Trauma team ready! Doors opened at the far end of the hall. Cold air rushed in from the ambulance bay. And Naomi Carter, the nurse nobody wanted to hear from, turned toward the sound of a dying soldier being brought back into her life. The helicopter did not land so much as beat the hospital into submission. Its blades hammered the roof above Baltimore Mercy General, sending a low vibration through the trauma floor. Ceiling tiles shivered in their metal frames. A plastic cup on the nurse's station trembled toward the edge of the counter until Evelyn caught it without looking. The sound came through Naomi Carter's ribs, not into her ears, into the bones. She stood in Bay 1 with gloved hands open at her sides, waiting. The trauma room had been stripped of anything unnecessary. Warm blankets stacked on a chair. Fluids hung high. The airway cart stood ready with drawers half cracked, labels facing out. The suction tubing lay coiled like a pale snake near the head of the bed. Monitors glowed, idle and patient. Dr. Victor Langford stood at the center of it. That was how he liked every room arranged. Around him, he had changed into surgical blues. His mask hung loose beneath his chin, his silver hair tucked beneath a cap, his hands resting on his hips as if someone had carved him into the place. Behind him, Dr. Ames checked the trauma tray. Patel hovered near the medication drawer, his eyes too wide. Evelyn stood near the doorway with a clipboard, listening to the radio report crackling through the wall speaker. 23-year-old male, Lieutenant Jake Thornton, military transport incident, blast exposure reported, found conscious, deteriorated en route, hypotensive, tachycardic, suspected abdominal trauma, possible pelvic involvement, 2 IVs established, receiving fluids, ETA 2 minutes. The words dropped into the room one by one. 23. Naomi kept her face still. 23 was barely old enough to understand the weight of the word lieutenant, barely old enough to have lost the boyish roundness from the cheeks, old enough somehow for the country to hand him authority, a rifle, a team, and a body full of metal. Langford turned to his team. We focus primary survey, airway, breathing, circulation. If the abdomen is open, we control the abdomen. No guessing, no drama. Clear? Yes, doctor, Ames said. Patel nodded. Naomi checked the blood tubing again. Langford saw her hands moving. Carter. She looked up. This isn't Bay 4. This is not a slow medical decline for you to narrate. When he comes through that door, you assist. You do not interpret. Evelyn's eyes cut toward him. Naomi said, understood. The helicopter wound down overhead. For a moment, there was a strange pocket of silence. Then the double doors at the far end of the unit burst open. Cold air rushed in first. After it came the stretcher. 2 flight medics pushed hard, boots squeaking on the old floor. A third walked backward, squeezing an IV bag with one hand and keeping pressure on a dressing with the other. Their jackets were dark, their faces wind-burned, their movements clipped and stripped down to necessity. On the stretcher lay Lieutenant Jake Thornton. He looked younger than 23. That was Naomi's first thought, and she hated herself for it because it was not useful. His face was gray beneath streaks of dirt and dried blood. His hair was cropped close, dark blonde, matted at the temple where a dressing had been taped in place. One eye was swollen almost shut. His lips had a faint blue cast that did not belong to the living. A cervical collar held his neck stiff. His uniform had been cut away in strips, the fabric bunched under him like discarded skin. Across his chest and stomach, tape held gauze pads in place. Some were bright red, some were dark and sticky. One near his lower left abdomen had already soaked through. A dog tag chain clung to his throat. It moved with each shallow breath. The lead flight medic called out before the stretcher stopped. Lieutenant Jake Thornton, 23, blast and rollover trauma, initial GCS 13, now 9. Airway intact but declining. BP 78 over 42 despite fluids. Heart rate 140, abdomen rigid. Penetrating wound left lower quadrant, unknown depth. Pelvis unstable on scene, binder placed. 2 large bore IVs, no known allergies. Last pressure in flight was 68 systolic. The stretcher locked into place. The room exploded into practice movement. On my count, Langford said. 1, 2, 3. They transferred Jake to the trauma bed. His body landed heavier than it looked. The monitor leads went on. Blood pressure cuff, pulse ox, oxygen mask, warm blankets over his upper body. Scissors flashed as Ames cut away more of the remaining uniform. Naomi moved to Jake's right side and took his wrist. His pulse was there, but weak and fast, slipping under her fingers like a thread pulled through water. Pulse thready, she said. Langford leaned over the abdomen, pressure dressing off. Ames removed the soaked gauze from the left lower quadrant. The wound underneath was ugly and loud. Torn flesh, dark blood, a deep puncture surrounded by bruising. It looked like the answer because obvious wounds often did. Langford's attention fixed on it. There, he said, that's our source. Naomi's eyes did not stay where his did. She had learned long ago that the loudest injury was not always the one killing the patient. Her gaze moved, chest rise uneven but present. No tracheal deviation, neck veins flat, pelvic binder tight, skin cool, fingertips pale. She leaned slightly, looking under the edge of the blanket as Tessa placed a warmer across Jake's legs. There were marks along his right side. Not dramatic, not like the open wound, not the kind that made a room gather around it. A faint crescent of bruising under the lower ribs. Blue-black mottling near the right flank. A scrape across the side where something hard had caught him and compressed deep, not sliced. Naomi's eyes narrowed. The blast had thrown him left, maybe. The rollover had pinned him right, or a restraint had driven force up beneath the ribs. His lower abdomen was bleeding, yes, but not enough to explain the speed of the collapse. His body was emptying somewhere deeper. She looked at the monitor. Heart rate 146. Blood pressure unreadable for a second. Then 64 over 38. Evelyn called it out. Pressure's falling. Hang blood, Langford ordered. Typo until cross-match. Ames, prep for chest and pelvis films. Patel, call OR. Tell them now. Patel rushed to the phone. Jake made a sound behind the oxygen mask. It was not speech, more like a trapped animal trying not to be one. Naomi leaned close. Lieutenant Thornton, she said, you're at Baltimore Mercy. You're in the trauma bay. You're not alone. His good eye fluttered. For half a second, it seemed to find her, then rolled away. Langford pressed the abdomen near the wound. Jake's body stiffened. There's guarding, Ames said. Because he's bleeding into the abdomen, Langford snapped. Thank you. Ames flushed. Naomi watched Jake's right shoulder twitch. Not from pain at the open wound. Referred pain, maybe. Right shoulder, right upper abdomen. Flank bruising, shock too severe for what they were seeing. A memory brushed the back of her mind. A man on a desert floor under a broken vehicle, saying his shoulder hurt while his belly filled with blood. Naomi pushed it away, but not the lesson. She reached for a pen light and lifted Jake's eyelid. Pupils reactive. She checked cap refill. Too slow. She moved the blanket farther down and saw the bruise more clearly now. A dark band blooming over the right upper quadrant, half hidden beneath dried dust and medical tape residue. The shape was wrong for superficial trauma. It had depth to it, a shadow rising from inside. "Doctor," she said. Langford was bent over the left abdominal wound. "Not now." His right flank. "I said not now, Sham." Naomi kept her voice calm. "The bruising pattern doesn't match the wound as primary source." Langford looked up slowly. The room kept moving, but the temperature seemed to drop. "What did you say?" Naomi pointed, not touching Jake. "Right lower ribs, flank discoloration, shoulder response. He may be bleeding higher than the visible wound." Ames looked over despite himself. Langford did not. He stared at Naomi. "Nurse Carter, he has a penetrating abdominal injury soaking through gauze in front of us." "Yes, but his pressure is dropping faster than..." "Than what?" Langford asked. "Than your impression?" Evelyn stepped closer, watching both of them. Naomi did not blink. "Then that wound explains." Langford's jaw tightened. He turned to Ames. "Fast exam." Ames grabbed the ultrasound probe. Naomi stepped back just enough to give room, but her eyes stayed on Jake's right side. The ultrasound image flickers heads on the screen. Grainy gray shapes, ribs, shadows, fluid spaces. Ames moved the probe over the abdomen, slick gel spreading across Jake's skin. "Free fluid present," Ames said. Langford's expression sharpened with satisfaction. "Exactly, abdomen. Get him upstairs." Naomi looked at the angle of the probe. "He checked the lower pocket," she said, "not Morrison's pouch." Langford went still. Patel stopped mid-sentence on the phone. Tessa looked down at the IV line. The only sound was the monitor and Jake's wet breathing. Langford turned his head toward Naomi. "Excuse me?" Naomi stepped nearer, her voice still low. "Check the hepatorenal space. Right upper quadrant." Ames hesitated with the probe in his hand. Langford noticed the hesitation and punished it with a look. "Padre Ames," Ames swallowed. "Yes, sir." He continued scanning where Langford indicated, lower abdomen, pelvis, around the visible wound. Naomi watched the screen. Not enough. There was free fluid, but that wasn't the whole story. Something was being missed above the line where Langford had already decided the truth ended. Jake's blood pressure alarm chirped again. Evelyn read it. 58/36. "Second unit," Langford ordered. "Move." The flight medic, still near the door, spoke up. He was complaining of right shoulder pain in flight. Langford shot him a glare. He was half conscious and in shock. He said it twice. Naomi's eyes went to the medic. The young man looked exhausted, no older than Jake, with a smear of blood along his sleeve. He met her gaze for a fraction of a second, and in that look she saw a simple thing. He had also noticed, and he knew no one wanted to hear it. Langford said, "Shoulder pain is irrelevant right now." Naomi said, "It may not be." Langford's face hardened. "Carter." Evelyn murmured, "Victor." He lifted one hand to silence her without looking. A terrible habit, a small gesture that said he had been obeyed too often for too long. Naomi looked back at Jake. His lips moved beneath the mask. She leaned close. A breath scraped out of him. "Don't," Naomi lowered her ear. "Don't let..." The words dissolved. She touched his shoulder lightly. "Don't let what?" His good eye opened, not fully, just enough. For a heartbeat, the trauma bay vanished from his gaze. He was somewhere else. Some road, some fire, some order he had failed to finish. "Don't let him," he whispered. Then his body shuddered. The monitor shrieked. "Pressure dropping," Tessa said, voice shaking. Langford snapped into full command. "We're done here, or now. Exploratory laparotomy, left lower abdominal source. Move." The team began preparing transport. Naomi looked at the ultrasound screen again. The wrongness in her gut grew colder. Not fear, recognition. A patient could bleed to death while everyone chased the injury that looked guilty. She stepped toward Langford. "Doctor, before you move him, scan the right upper quadrant." His eyes flashed. "We don't have time for your checklist." "It's not a checklist." "No, it's worse. It's amateur speculation." Naomi's voice dropped. "He has flank ecchymosis on the right, referred shoulder pain, rapid hypotension, and not enough external loss to explain his collapse. If the liver or subhepatic space is involved." Langford laughed once, not because anything was funny, because contempt needed somewhere to go. "Listen to yourself." The room froze around the edges. Naomi could feel Evelyn staring at her, could feel Tessa scared for her, could feel the residents begging silently for the confrontation to end so they could keep moving. Langford stepped closer. "You think you've discovered a hidden injury while standing at bedside for 3 minutes?" Naomi said, "I think he's dying from something we haven't controlled. He is dying from abdominal trauma, which is why I am taking him to surgery." "Then look where the bleed is." "I know where the bleed is." "No," Naomi said quietly, "you know where the wound is." That was the sentence that changed the room. Not loudly, not with shouting. It landed soft, and because it was true, it hit harder. Langford stared at her as if she had slapped him. For 1 second, the older surgeon's face showed something naked and unpleasant. Not doubt, not yet. Pride defending itself before reason could enter. Then he raised his voice. "Nurse, stay in your lane." Naomi held her ground. Jake's monitor kept screaming. Langford moved closer until they were separated by the width of the trauma bed. "You are not running this room. You are not diagnosing my patient. You are not redirecting my team based on battlefield fantasies or whatever you think you're seeing in a bruise." The word battlefield struck something deep behind Naomi's ribs. Her face remained still. But Evelyn heard it too. She looked sharply at Naomi. Langford continued, each word colder than the last. "You will update the chart, you will assist when asked, and you will stop interrupting before your overconfidence kills someone." Naomi's eyes flicked to Jake. He was the one dying, not from her overconfidence, from delay. Langford turned away. Transport. Ames and Patel began unlocking the bed. Evelyn stepped in. "Victor, if she's seeing something..." "I am not holding a critical patient in the bay because Nurse Carter found a bruise." Evelyn's mouth tightened. The flight medic said, quieter now, "Sir, his pressure. I can read a monitor." No one else spoke. That was how command failed. Not always through stupidity, not always through malice. Sometimes through a room full of people who knew something was wrong and waited for someone with permission to say it. Naomi had seen men die in that kind of silence. She had made promises to herself about it. But this was not the desert, not a field hospital, not a blacked-out transport under fire. She did not have command here. She had a badge with RN under her name and a surgeon in front of her who could end her career by lunch. The bed began moving. Jake's hands slipped from beneath the blanket. His fingers curled weakly in the air. Naomi caught them. His skin was cold, too cold. For half a second, she was back in another place with another young soldier whose hand had done the same thing, reaching for anything human before the dark took him. Jake's eye opened again. He stared at her without focus, but his fingers tightened around hers. It was barely pressure. Still, it was a request. Naomi leaned closer. "I'm here," she said. Langford's voice snapped from the foot of the bed. "Carter, let go. We're moving." Jake's lips moved. No sound came at first. Then faintly, "Right." Naomi bent lower. "Right side?" she asked. His eyelid trembled. "Burns." Not Burns. Burns was probably a name, or maybe a memory. His breath hitched. "Right." The monitor lost the blood pressure reading again. The pulse ox waveform flattened, then returned weakly. Evelyn cursed under her breath. Naomi released Jake's hand and moved to the side of the bed, walking with it as they pushed toward the elevator. She kept one hand on the rail. Langford strode ahead, already calling orders into the corridor. "Notify OR2 we're opening. Massive transfusion protocol. I want anesthesia ready. Ames, you assist. Patel, observe and do not touch anything unless I tell you." The trauma team moved like a small storm. Doors opened. People stepped aside. A visitor holding flowers pressed herself against the wall, eyes wide. Jake's bed rolled beneath fluorescent lights that flashed across his face in pale bars. Naomi watched his abdomen. The left wound bled through another dressing, but his right side had changed. The bruise was darker now, spreading at the edge. The skin above it looked tight, subtle, easy to miss if you had already made up your mind. At the elevator, the doors opened with a slow, metallic groan. Langford turned and pointed at Naomi. "You're not needed upstairs." Evelyn looked at him. "She's trauma nurse on intake. She has done enough." Naomi said nothing. Langford stepped closer, lowering his voice. "I don't know what you were trying to prove down there, but I won't have it in my OR. Do you understand?" Naomi looked at Jake. The young lieutenant's chest rose under the oxygen mask, shallow and uneven. His dog tags had slipped sideways, half hidden beneath a smear of dried blood. There was a small scar on his chin, the kind boys got from falling off bikes before they became men who fell out of burning vehicles. Naomi looked back at Langford. "I understand he's still bleeding." Langford's eyes went flat. "For the last time, Carter." The elevator alarm dinged. Inside, the transport nurse waited. Langford straightened, reclaiming his public face. "Return to the floor," he said. "Update your chart." Then he entered the elevator with Jake, Ames, Patel, and anesthesia. The doors began to close. Naomi stood outside, one hand still gloved, palm marked with Jake's blood where his fingers had gripped her. Just before the doors sealed shut, Jake's head shifted slightly on the pillow. His good eye found her again. Not clearly, not knowingly, but desperately. Naomi held his gaze until Steele cut it away. The elevator doors closed. The hallway filled with ordinary hospital noise again. A phone ringing, a cartwheel squeaking. Someone laughing too loudly near the vending machines because life had a cruel way of continuing. Evelyn stood beside Naomi. For a moment, neither spoke. Then Evelyn said, "You really think he's wrong?" Naomi looked at the closed elevator doors. "No." Evelyn turned to her. Naomi's voice was quiet. "I know he is." Evelyn studied her face. "How?" Naomi did not answer. Not fully. She looked down at the blood drying on her glove. Young blood, soldier's blood, the kind that had followed her into dreams for years and still knew how to find her in daylight. Finally, she said, "Because the body tells the truth before the chart does." Upstairs, beyond the sealed elevator and sterile halls, Dr. Victor Langford was preparing to cut into the place where the wound looked worst. And Naomi Carter, ordered back into silence, stood on the trauma floor listening to a truth no one else wanted to hear. The OR smelled different from the trauma floor. Downstairs, everything carried the human evidence of emergency: sweat, winter air, dirty coats, burnt coffee, fear. Upstairs in operating room 2, the air had been scrubbed until it felt almost empty, cold, metallic, bright enough to make every surface confess. Lieutenant Jake Thornton lay under the surgical lights, his body draped in blue except for the field of exposed abdomen where Dr. Victor Langford had chosen to fight the war. Machines surrounded him like witnesses. The ventilator sighed in fixed rhythm. The suction canister filled in ugly bursts. The cardiac monitor kept its hard green line moving across the screen, each beep clipped and anxious. Heart rate, 152. Blood pressure, 62/30. Then lower, then unreadable. An anesthesiologist named Dr. Helen Marks stood at the head of the table, her eyes fixed on the numbers. She was a narrow woman in her late 40s with no patience for performance. Her hands moved over syringes and tubing with quiet speed. "He's not tolerating this," she said. Langford did not look up. "He's in hemorrhagic shock. Keep up with the blood." "We are keeping up." "Then keep up faster." No one answered. Ames stood opposite Langford, retractors in place, his shoulders tense beneath his sterile gown. Patel stood near the back wall, scrubbed in but silent, watching with the pale concentration of someone afraid to breathe wrong. Naomi Carter was not supposed to be there. Langford had made that clear. "Return to the floor. Update your chart." She had done neither. For exactly 48 seconds after the elevator doors closed downstairs, Naomi stood in the hallway with Jake Thornton's blood drying across her glove. Evelyn had watched her. No speech, no command, just the old nurse's eyes asking the question out loud people rarely had the nerve to say. Are you going to obey, or are you going to do what needs doing? Naomi had stripped off the bloody gloves, washed her hands, signed into the surgical floor as assisting trauma nurse under intake continuity. No lie, no drama. A narrow doorway through policy. Now she stood at the edge of OR2, scrubbed, masked, gloved, and unwelcome. Langford had noticed her the moment she stepped in. His eyes had cut toward her above his mask. Who authorized you? Naomi had answered evenly. Continuity of trauma care. I told you that you weren't needed. Dr. Marks had looked up from the head of the table and said, I need hands. She can stay unless you want to argue while he crashes. That ended the public argument, but not the war. Langford went in through the left lower quadrant, chasing the obvious wound. His scalpel opened skin and fat. Blood welled up, dark and slick under the lights. Suction caught some of it. Sponges swallowed the rest. At first, the room followed his confidence. The visible injury had promised an answer. It had pulled every eye toward it like on in a dark field. But the body did not care what looked convincing. Jake's pressure kept falling. Another lap pad, Langford said. Naomi placed one into Ames's waiting hand before he asked twice. Ames packed. Langford probed deeper. Suction screamed, then gurgled. Blood kept coming, but not with the force they expected. Not enough to explain the numbers. Naomi watched from her station near the instrument table. She did not watch Langford's hands only. She watched the patient. The chest rise, the skin tone, the monitor trends, the little delay between intervention and response that told the truth before anyone spoke it. Jake's body was not improving. It was leaving. Pressure? Langford asked. Dr. Marks replied, 54 systolic. Impossible. The word slipped out of him before he could make it sound professional. Dr. Marks looked over the drape. That is the number. Give more blood and miss. Massive transfusion is running. His pressure is not responding. Langford's shoulders stiffened. He leaned deeper into the abdomen. Source has to be here. Naomi heard it, not as a statement, as a plea. It had to be there because he had said it was there, because a room full of people had heard him say it, because a surgeon like Victor Langford did not get to be wrong in front of residents, fellows, nurses, anesthesia, and a dying soldier who could not argue for himself. Ames adjusted the retractor. I'm not seeing major arterial bleeding here, he said carefully. Langford's eyes snapped up. You're not seeing because you're pulling like you're afraid of the anatomy. Ames swallowed. Yes, doctor. Naomi looked at Jake's right side beneath the drapes. Hidden, ignored. The bruise she had seen in the trauma bay was no longer visible, but it remained in her mind as clearly as if someone had drawn it across the sterile field in black marker. Right flank, lower ribs, shoulder pain, rapid collapse, fluid higher than checked. Morrison's pouch, subhepatic space. She could feel the old map inside her head. Not from textbooks alone, from bodies under bad light, from field hospitals where the floor shook, from listening to medics describe mechanisms of injury while dust landed in open wounds, from learning that the body stored truth in patterns, and that command meant seeing the pattern before panic erased it. The monitor beeped faster. Then irregular. Dr. Marks leaned in. He's getting ectopy. Langford said, calcium. Already given. Then repeat it. Naomi's eyes moved to the clock on the OR wall, 12:11 p.m. The second hand dragged itself forward, a stupid, ordinary wall clock. She knew how long 90 seconds felt when a body was falling away. It was not a minute and a half. It was a hallway with no doors. It was enough time for a man to die because everyone was careful with hierarchy. Langford removed another sponge and threw it into the basin. Where is it? He muttered. No one answered. His hands were still precise, but the room could feel the change. Confidence had become force. Force had become hunting. He was no longer moving through a plan. He was tearing through his own certainty, looking for proof. Ames tried again, quieter. Should we extend exposure? We have exposure. To the right upper quadrant? Langford froze. The air sharpened. Naomi looked at Ames. Ames did not look back. Langford's voice dropped. Did Nurse Carter recruit you during transport? No, sir. Then don't echo bedside gossip in my OR. Dr. Marks said, Victor. He ignored her. "We have an abdominal wound, free fluid, and a crashing patient. We control what's in front of us." Naomi stepped half a pace closer, not enough to challenge, enough to be heard. "Doctor, what's in front of us isn't killing him fast enough." Langford turned slowly. Only his eyes were visible above the mask, but they carried enough fury for the whole face. "Step back." Naomi did not. The monitor alarm changed tone. Dr. Marks said louder bow, "Pressure 48/30. The room moved in small, strained pieces. Patel glanced toward the door, as if help might enter from nowhere. Ames kept his hands in place, but the tendons stood out in his wrists. Tessa had been sent upstairs as runner and now stood near the supply cart, pale behind her mask, clutching a fresh pack of lap sponges. Langford bent back into the wound. "Suction." Naomi handed suction to Ames. Langford probed deeper. "Damn it," he said. It was soft. That made it worse. Naomi felt her pulse settle. In certain kinds of emergencies, her body did a strange thing. It did not speed up. It narrowed. Sound separated into layers. The ventilator, the monitor, the suction, Langford's breathing beneath his mask, Dr. Marks counting blood units under her breath, the slight squeak of Patel shifting his weight, and under all of it, a young man's life slipping through an unseen tear. Naomi looked at the wall clock again. The second hand hit 12. A full minute, maybe less. There were rules, there were licenses, there were chains of command. There was also a table with a 23-year-old soldier on it. She moved, not fast at first, deliberate. Ames saw her coming and his eyes widened. Langford did not notice until she was beside him. "Doctor," she said, "get away from my field." "Subhepatic quadrant." The words landed clean. Langford's head lifted. "What?" "Right upper quadrant, subhepatic. Pack it now." Langford stared at her as if the room had tilted. Naomi stepped closer to the table, close enough that her sterile gown nearly brushed his sleeve. "He has blunt compression trauma on the right flank, referred shoulder pain, unstable pressure, unresponsive to abdominal wound control, and free fluid you didn't fully localize. The bleed is above where you are working." Langford's voice rose. "You are contaminating my OR with speculation." Naomi's eyes did not leave his. "No, I'm trying to keep him alive." "Step back. Pack the subhepatic space. Security will remove you from this room. Then they can do it after you pack the bleed." The monitor screamed again. Dr. Marks said, "We are losing him." That stripped the air bare. No rank in the room mattered in that sound. Langford looked at the monitor. Heart rate 164, pressure 42/28, oxygen dipping. Jake's body was making the decision for them. Langford turned back to the wound, stubbornness gripping him even now. More suction. Naomi saw his right hand moving toward the same wrong place. Something inside her went still. Not cold, not angry, decided. She reached across, caught Langford's wrist just above the sterile glove, and stopped his hand. The OR went silent except for the alarms. Ames looked as if he had seen someone strike a priest at the altar. Patel whispered, "Oh my God." Langford's eyes went wide. For a fraction of a second, he was too shocked to speak. Naomi did not squeeze. She did not shove. She simply held his wrist away from the mistake. Her voice was low and hard. "Dr. Langford, you can fire me when he has a pulse." Then she released him, turned to Ames and pointed. "Retract higher, right upper quadrant, now." Ames did not move. He looked at Langford. That was the last chain. Naomi leaned toward him. "Dr. Ames, look at your patient." Ames looked down, not at Langford, not at Naomi, at Jake. The young soldier's face was almost waxen beneath the drapes. His lips had gone pale blue again. The ventilator moved his chest, but the life beneath it was thin. Ames changed his grip. Langford barked, "Ames." Ames flinched, but he held the retractor higher. Dr. Marks said, "Do what she said or call the time of death. Those are our choices." That ended it, not because Langford agreed, because the room no longer followed him blindly. Naomi reached for lap pads. "Pack here," she said, placing them into Ames's hand. "Deep, up and under." Ames followed the line she indicated. Langford stepped back in, furious but trapped by the reality of the open body before him. If this is wrong, it isn't. The answer came from Naomi before he finished. He stared at her. She stared back. Then he moved. Not gracefully, not with acceptance. With the rough obedience of a man forced by circumstance to touch the truth. He extended the incision, opened exposure toward the right upper quadrant, and slid his hand deeper than he had before. Ames lifted. Suction cleared the field. For half a second, nothing changed. Then the wound filled. Not from the left, from above. A dark surge spilled into the field, thick and sudden, blooming where Langford had not been looking. Ames inhaled sharply. There, Dr. Marks looked over the drape. Tell me that's controllable. Langford did not answer. His hand moved now with real urgency. Naomi gave him another lap pad before he asked. Pack posterior to the liver, she said. Langford snapped. I know how to pack a liver. Then do it. The words struck, but there was no time to punish them. He packed. One pad, then another. Naomi counted in her head. 10 seconds. The bleeding slowed but did not stop. More, she said. Langford packed again, deeper under the liver, compressing the hidden space where blood had pooled and poured while everyone stared at the obvious wound. 20 seconds. Ames adjusted the retractor, sweat shining at his temple beneath the cap. Pressure? Naomi asked. Dr. Marks glanced at the monitor. Still low, 46. Naomi said, Hold pressure, don't chase it. Hold. Langford pressed both hands into the packing. For the first time since the case began, he did not speak. 30 seconds. The suction quieted. Not fully. Enough. The pool stopped rising so fast. Dr. Marks pushed medication. Come on, Lieutenant. Naomi looked at the clock. 37 seconds. Jake's heart rhythm stuttered. For one terrible moment, the green line broke into uneven peaks. VTOC? Patel whispered. No, Dr. Marks said. Not yet. Don't give him ideas. Naomi moved to the side of the table, close to Jake's shoulder. She knew he could not hear her. Not truly. Not through anesthesia, shock, blood loss, and the machine breathing for him. Still, she leaned in. Hold the line, Thornton. No one else heard. Or if they did, no one mentioned it. 50 seconds. Langford's arms trembled slightly from pressure. Ames said, Bleeding is slowing. Naomi looked at the field. Don't release yet. Langford's eyes flicked toward her, but he did not argue. That was when the room changed. Not visibly. The lights were still bright. The machine still worked. The same people stood in the same positions. But command had shifted, not officially, not on paper. The room had turned toward the person who was keeping the patient alive. 63 seconds. Dr. Marks read the monitor. Pressure 52 systolic. Tessa exhaled too loudly and then looked embarrassed. Naomi did not move. Wait, Langford pressed. Blood seeped around the edges, but no longer flooded. The packing had found the space. The hidden injury had finally been forced into daylight. 74 seconds. Dr. Marks said, 58. Ames looked up. He's responding. Patel whispered, Jesus. Naomi watched the monitor. 81 seconds. The heart rate began to edge down. Not safe, not stable, but less frantic, less desperate. 89 seconds. Dr. Marks said, 64 over 40. The room seemed to breathe for the first time. Naomi lowered her eyes. There it was, a pulse returning through the numbers. Not victory, not yet, but permission to keep fighting. Langford slowly released one hand to check the field. Careful, Naomi said. His head snapped toward her. The old anger flashed, but he released slowly. The packing held. The bleeding stayed controlled. Ames's shoulders dropped half an inch. Dr. Marks said, pressure 72 over 46. Keep doing whatever you're doing. No one laughed, not because it was not funny, because everyone knew what had just happened, and none of them knew where to put it. Langford stared into the operative field. The source was exactly where Naomi had said it would be. Subhepatic, hidden, deadly. He had missed it. The facts stood in the room with them. Naomi reached for another instrument and handed it to him. Clamp! He took it automatically. Their gloves brushed. His eyes lifted to hers. For the first time since she had known him, Victor Langford looked at Naomi Carter without seeing only a nurse. He saw a problem, maybe a threat, maybe something he should have recognized sooner, but not nothing. That was new. "Continue packing," Naomi said. The words were quiet. Langford's pride twitched under them. Dr. Marks cut in before he could answer. "Victor, for the love of God, continue packing." He did. The next several minutes became work. Real work. No speeches, no theater, no clean lines of authority. Just hands, blood, pressure, suction, clamps, sutures, and the stubborn human labor of pulling a man back by inches. Langford found the deeper tear along the inferior surface, where blunt force had driven the liver against bone and compressed vessels hard enough to open them. Not a neat wound, not a textbook injury, a nasty hidden bleed tucked where delay would have killed Jake long before anyone admitted the first theory had been wrong. Ames assisted better now, less stiff, more focused. Patel fetched without being told twice. Tessa opened supplies, her hands steadier than before. Naomi stood close enough to see the field and far enough not to crowd the work, anticipating needs before they became requests. Another pack. It was already in her hand. Suction. Ready. Long clamp. Placed. Langford stopped snapping because there was no room left for the performance. The case had taken his vanity by the collar and shoved it aside. Dr. Marks watched the numbers climb with wary disbelief. Pressure 82/50. No one celebrated. In the OR, celebration before closure was how people tempted disaster. But the air shifted again. It warmed by a degree. Ames looked once at Naomi, quick and almost afraid. She did not acknowledge it. She watched Jake. The soldier had color returning faintly to his face. Not much. A thin, reluctant wash beneath the gray. His dog tags had been taped aside by someone before surgery. The chain still marked the skin at his throat. Naomi's hands remembered another tag chain. Another boy. Another table. She swallowed it down. There would be time for ghosts later. Maybe. For now, the living needed instruments. "Temporary control achieved," Langford said finally. His voice was rougher than before. Dr. Marks answered, "Hemodynamics improving, not pretty, but improving. Prepare for definitive repair." Ames nodded. "Yes, doctor." Langford adjusted his stance. The old authority tried to return to his shoulders, but it did not fit the same way. The team continued. Naomi stayed silent now. She had said what needed saying, done what needed doing. Anything more would only feed the room's hunger for drama. But the room kept looking at her. That was the trouble with saving a life in front of witnesses. People wanted a story they could understand. A nurse saw what a surgeon missed. A nurse touched a chief surgeon's hand. A nurse gave an order in an operating room, and the patient's blood pressure came back. None of that fit the hospital's polite architecture. At 12:49, Jake Thornton was not safe, but he was no longer actively slipping away. The bleeding had been controlled. The field was packed. The repair was underway. Blood products continued. His pressure held in the low but livable range. Dr. Marks removed one glove and wiped sweat from her forehead with her sleeve. "Lieutenant's stubborn," she said. Naomi looked at the monitor. "Good." Langford did not look up. Stubborn patients survive sloppy situations. No one answered. The sentence sat there trying to blame the chaos on the patient, the injury, the situation. Anything but the missed call. Naomi did not challenge it. Not then. She had learned something about men like Langford. They could tolerate being corrected in a crisis if they later found a way to rename the correction. Luck. Instinct. A lucky guess. A nurse overstepping, but happening to be right. They would rebuild the world around their pride if given enough time. But there were too many witnesses, and the truth had bled in front of all of them. Ames finally spoke, voice low. "Dr. Langford." "What?" Ames hesitated. Naomi could feel the young surgeon deciding whether his future was worth one sentence. Then he said it. She was right. The room went still again. Not alarmed still, human still. Langford's hand stopped for less than a second, then resumed. "She observed a sign," he said. "We acted accordingly." Ames looked down. "Yes, sir." It was not enough, but it was something. Dr. Marks gave a dry laugh from behind the drape. That's one way to describe a mutiny that saved the patient. Langford shot her a look. She ignored it. Naomi reached for a fresh sponge. Langford said, "Carter." She looked up. For once, the way he said her name did not sound like a reprimand. Not exactly. He seemed to search for words and hate everyone available. Finally, he said, "Next time you raise the concern through proper channels." The insult was so small compared to what had happened that it almost disappeared. Almost, Naomi held his gaze. "Next time," she said, "listen the first time." Ames looked at the field. Patel stopped breathing again. Dr. Marks's eyes smiled above her mask. Langford stared at Naomi. No one spoke. Then Jake's monitor beeped steadily into the silence. One beat, another. The young man on the table, still unconscious, still torn open, still balanced between years and seconds, had the final word. Langford looked away first. "Close when ready," he said to Ames. "Careful with the packing." Work resumed. Naomi stepped back from the table. Only then did she notice the ache in her own hands. She had clenched them so tightly her fingers hurt inside the gloves. She flexed them once, slowly. Blood had splashed across the front of her gown. Not much. A dark fan near her waist. It would be disposed of with the rest. Bagged, tied, burned, or buried in hospital waste. Evidence erased. But not all of it. Something stayed. The moment Langford's hand stopped under hers, the first rise in blood pressure, the way the room turned, the look on Jake's face downstairs when the elevator doors closed. Naomi turned toward the small OR window set high in the door. Beyond the glass, a strip of hallway showed passing shapes, blurred by motion and distance. Somewhere below, Harold Finch's wife was probably still holding his hand. Mrs. Delgado was probably complaining about hospital soup. Evelyn was probably pretending not to worry. And here, under white lights, a young soldier had been given back the only thing trauma ever stole cleanly. Time. Not much, but enough. When the repair was finally underway and the immediate danger had been beaten back, Dr. Marks gave Naomi a glance. "You military?" she asked quietly. Naomi did not answer. Dr. Marks studied her a moment longer. "No civilian nurse I know says, 'Hold the line like that.'" Naomi looked at Jake. His chest rose and fell with the ventilator. "Steady, for now." "I've worked trauma," Naomi said. Dr. Marks snorted softly. "So have I." Naomi said nothing. Across the table, Langford heard the exchange. His eyes shifted toward Naomi. For the first time, suspicion entered where contempt had lived comfortably all morning. Not respect, not yet. Something more uneasy, curiosity. Naomi saw it and turned away. She had no interest in being discovered. Discovery was not always rescue. Sometimes it was another kind of exposure, another room full of people deciding what your past meant to them. She had come here to work, to be useful, to disappear into competence. But the blood had found the old door. And today, in front of Langford, Ames, Patel, Marks, in a room full of witnesses, Commander Naomi Carter had stepped through it for exactly 90 seconds. Long enough to save a hero. Long enough to make silence impossible. By 5:38 that evening, the sunlight had left Baltimore Mercy General. It did not leave gently. It slid off the windows in thin gold strips, caught for a moment on the glass towers downtown, then vanished behind the brick buildings and winter gray rooftops west of the harbor. What remained was the hospital's real light, fluorescent, pale, and unforgiving, the kind that made everyone look tired. The post-op recovery unit sat 3 floors above the trauma bay, quieter than downstairs but not peaceful. Nothing in a hospital was peaceful. There were only different volumes of worry. Machines breathed, pumps clicked, rubber soles whispered over wax tile. Somewhere beyond the double doors, a family argued softly about who should call the mother. A custodian pushed a mop bucket down the corridor, the wheels squeaking once every rotation like a small animal in pain. Lieutenant Jake Thornton lay in Recovery Room 6, alive by the narrowest margin the human body could offer. He had tubes in both arms, a central line, a drain beneath the dressing on his abdomen, bruises darkening across his ribs and flank like storm clouds under the skin. His face had been cleaned, but not entirely. There was still a faint line of dried blood near his ear where the sponge had missed the fold. The ventilator had been removed an hour earlier. That had been the first good sign. He breathed on his own now, shallow but steady, oxygen hissing through a nasal cannula. Every breath seemed to cost him something. His chest rose carefully, as though the body knew one wrong move could reopen the day. Naomi Carter stood at his bedside with a clipboard tucked against her hip. She was back in clean scrubs. Her surgical gown had been discarded, the blood washed from her hands, her cap replaced, her badge wiped clean until it reflected the room's thin light. Nurse Carter. The letters remained ordinary. Her face did too. To anyone passing by, she looked like a calm nurse checking vitals after a difficult case. Only Evelyn Brooks would have noticed the difference in her shoulders. Not much, a fraction tighter. A person holding a door closed from the inside. Naomi checked Jake's pulse manually, 2 fingers against the inside of his wrist. The monitor already showed the numbers. She trusted her fingers more. Pulse, weak, regular, skin, warmer than before. Pressure, close but holding. Pain response, present. He was still in danger. Trauma did not give back a life all at once. It loaned it hour by hour, asking for payment and vigilance. Naomi wrote the numbers down. Behind her, Dr. Helen Marks stepped into the room, rubbing the bridge of her nose beneath her glasses. "How's our favorite miracle?" Marks asked. Naomi did not look up. "Still requiring close observation." "That's nurse language for not dead yet." "That too." Marks came to the foot of the bed and studied Jake. The anesthesiologist had changed out of OR scrubs into a dark sweater under her white coat. She looked older than she had during surgery. Everyone did after nearly losing a patient. "Langford's writing the operative note," Marks said. Naomi kept her pen moving. "I'm sure it's accurate." Marks gave her a look. That was almost a joke. Almost. He wrote additional right upper quadrant exploration performed after multidisciplinary reassessment. Naomi's expression did not change. Marks snorted. "Multidisciplinary reassessment. That's what we're calling you," grabbing his wrist now. Naomi clicked the pen closed. The patient survived. He did. That's the note that matters. Marks studied her for a moment. "You know he's going to make trouble." Naomi adjusted Jake's blanket, smoothing it over his shoulder. "He already has." "I mean officially." Naomi looked toward the doorway. The hall beyond was empty, except for a passing nurse carrying a tray of meds. "Official trouble usually arrives wearing polished shoes," she said. Marks almost smiled. "You always talk like that?" "No. Only when you're dodging a question." Naomi checked the IV site. "Mostly." Marks stepped closer, lowering her wawasan. "I've worked with trauma nurses 20 years. Good ones, great ones. I've seen sharp calls. I've seen instinct. What happened in that OR wasn't instinct." Naomi said nothing. Marks continued. "You knew the mechanism. You knew the pattern. You knew how much time he had. You didn't guess. You commanded." That word entered the room and sat down between them. Commanded. Naomi's hand paused on the IV tape, then resumed. "I raised a clinical concern," she said. "You stopped a surgeon's hand in a sterile field. He was going the wrong direction." Marks looked at her for a long second. Then she nodded, not satisfied, but respectful enough to stop pressing. "His unit has been calling every 15 minutes, she said. "Family, too. Parents are flying in from Ohio. Command rep is on the way." Naomi's fingers stilled. "What command rep?" "Didn't catch the name. Mason something. Riley maybe. Big title. Bigger voice, right?" Naomi turned slightly. For the first time all day, something crossed her face before she locked it down. Marks caught it. "You know him?" "No." It came too fast. Marks noticed that too. Naomi looked back at Jake. "I knew someone by that name." "Military?" Naomi did not answer. Marks was smart enough to hear the closed door. "All right," she said. "I'll be around if he destabilizes." Naomi nodded. Marks left the room. The door sighed shut behind her. For a while, there was only Jake's breathing and the soft pulse of machines. Naomi stood beside him in the quiet, watching the faint movement of his eyelids beneath bruised skin. Sedation loosened in stages. First the fingers, then the breath, then pain, then memory, if the mind was unlucky enough to reach it. A young soldier waking after trauma did not return to the hospital first. He returned to the last place he had been afraid. Naomi had seen it too many times. Men waking with fists clenched around invisible rifles. Women trying to sit up because they thought their team was still outside. Kids with rank on their collars calling for names no one in the room recognized. The body came home before the mind did. She leaned close and checked Jake's pupils. "Lieutenant Thornton," she said quietly, "you're at Baltimore Mercy General. Surgery is over. You're breathing on your own." His eyelids fluttered but did not open. Naomi continued, "You're safe for now." For now, she never liked lying to patients, not even kind lies. Jake's hand twitched against the blanket. Naomi watched it. His fingers moved again, not random, searching. She placed her hand lightly beside his, not holding, just present. "Easy," she said. His fingers brushed hers, a faint pressure. Then his lips parted. No words came. His throat worked painfully. Naomi reached for the swab and moistened his mouth. "Don't force it." His eyes opened a slit, blue-gray, unfocused, glassy with pain medication and shock. He stared at the ceiling first, then the lights, then the monitor. His breathing quickened. The heart rate ticked up. Naomi stepped into his line of sight. "Lieutenant, look at me." His eyes found her. At first they did not know her. That was normal. She kept her voice calm, low and even. "You're in Baltimore. You're in recovery. Your surgery is finished. You lost a lot of blood, but you're alive." His eyes moved over her face. Something changed, not recognition all at once. A flicker, then confusion, then disbelief so deep it looked like fear. Naomi felt it before he spoke. His fingers tightened around the blanket. His cracked lips moved. She leaned closer. A whisper came out, raw and barely human. "Commander?" Naomi went still. Jake swallowed, grimacing. His eyes filled with the effort of seeing through pain, drugs, and whatever memory had dragged her name up from the dark. "Commander Carter." The monitor beeped faster. Naomi's face did not move, but the room did. At the doorway, Tessa Reed had arrived with a tray of supplies. She stopped so abruptly a roll of gauze slid to the floor and bounced once. Evelyn, just behind her, heard it too. "Say that again, honey?" Evelyn asked, stepping inside. Jake's gaze stayed locked on Naomi. His voice broke into a whisper. "You're here?" Naomi inhaled once, slow, controlled. "Lieutenant Thornton," she said, "don't talk. You're recovering." But he was past obedience. Some memories outranked pain. His hand lifted an inch from the bed, shaking with effort. Not reaching for water, not reaching for a nurse, reaching for her. "You made it," he whispered. Tessa's eyes widened. Evelyn looked from Jake to Naomi. The machines kept counting. Naomi gently lowered Jake's hand back to the blanket. "You need to rest." Jake's eyes sharpened for half a second. In that half second, he was not a patient. He was a soldier recognizing command. His lips moved again. "Team said, you were gone." Naomi's jaw tightened. "Rest, Lieutenant." He blinked slowly, fighting sedation. Then he whispered the sentence that would leave the room and travel through the hospital before night shift found the coffee machine. "That's my commander." No one spoke. Tessa stood frozen, holding the supply tray like a shield. Evelyn's face had changed completely. All the teasing, all the hardened nurse sarcasm, all the easy affection had been pushed aside by something older and more careful. Respect, yes, but also hurt, because she understood that Naomi had been carrying a history alone while people like Langford stepped on her name all morning. Evelyn said softly, "Naomi?" Naomi did not look at her. Her eyes stayed on Jake. "His heart rate is elevated," she said. "He needs quiet." It was a nurse's sentence, a wall made out of protocol. Evelyn did not challenge it. Tessa bent to pick up the fallen gauze, her face flushed. I'll restock later," she said. She backed out. Evelyn remained. Naomi checked Jake's oxygen line, though it did not need checking. Evelyn's voice was low. "Commander?" Naomi adjusted the blanket. "He's sedated. He knew your name. He read my badge. Your badge doesn't say Commander." Naomi's hand stopped. Evelyn waited. In the hallway, footsteps approached, heavier than the usual hospital traffic, more deliberate. A cluster of voices, low and official. Naomi heard them before they reached the door. One voice in particular. deep, roughened by age, smoke, command tents, and too many memorial services. A voice she had last heard through a phone she did not answer. Her shoulders went still. Evelyn noticed. The door opened. Dr. Langford entered first, because men like him found ways to arrive before truth could settle without them. He wore a fresh white coat now over his scrubs. His hair had been combed back. His face had regained its polished severity, though the day had left faint shadows under his eyes. Behind him stood two hospital administrators, Nora Whitcomb, chief medical officer, sharp-suited and composed, and Alan Pierce from risk management, a soft man with worried glasses and a clipboard hugged to his chest. But the man who entered last changed the room. He was in his late 50s, broad through the shoulders, with close-cropped gray hair and a face cut by weather and discipline. He wore a dark dress uniform pressed so cleanly it seemed to have brought its own gravity. Rows of ribbons crossed his chest. Silver and gold caught the hospital light. His shoes made no squeak against the floor. Command Master Chief Mason Riley. Naomi knew him before Evelyn read the nameplate. Mason Riley stopped just inside the door. His eyes went first to Jake. The young lieutenant lay pale and battered, breathing through pain. Riley's face tightened, but only around the eyes. A man like him did not display fear. He stored it until it became action. Then his gaze moved to Naomi. The air left the room. Not literally, but Evelyn felt it. So did Tessa, who had drifted back into the doorway despite herself. So did Langford, whose expression sharpened as he sensed a story developing outside his control. Riley stared at Naomi Carter as if the years between them had collapsed into one hard line. For a moment he did not move. Then he straightened. Not casually, not politely, fully. His heels came together. His shoulders squared. His right hand rose with exact military precision, and in the quiet recovery room of Baltimore Mercy General, Command Master Chief Mason Riley saluted Nurse Naomi Carter. No one breathed. Naomi's face changed then. Only a little, but enough. The woman who had taken Langford's contempt without flinching, who had stood over a dying soldier and forced a room to see what it missed, who had hidden behind blue scrubs and a cracked badge, looked suddenly exposed, not weak, exposed. Riley held a salute. Jake, barely conscious, saw it through half-open eyes. His cracked lips curved faintly. Not a smile. Recognition. Naomi did not return the salute immediately. Her hand remained at her side. The hospital room was not a parade ground. She was not in uniform. She had left that life with signatures, silence, and a closed door that had stayed closed until this day forced it open. Riley did not lower his hand. Langford looked from Riley to Naomi. "What is this?" he said. No one answered him. Naomi finally raised her hand, not fast, not with ceremony for the room, with respect for the man saluting her and the wounded lieutenant between them. She returned the salute. For 3 seconds, the past stood upright. Then both hands came down. Riley's voice was rough. "Commander Carter." Naomi said, "Master Chief?" Evelyn closed her eyes once. Tessa whispered, "Commander." Nora Whitcomb looked sharply at Langford. Langford looked as though he had bitten into something bitter and could not spit it out in public. Riley stepped toward Jake's bed. "How is he?" Naomi answered before Langford could. "Post-op from abdominal trauma with liver involvement and subhepatic hemorrhage. Massive transfusion initiated. Bleed controlled surgically. He's unstable but improving." He woke briefly and recognized surroundings. Riley nodded once, that was all. No wasted reaction. Then he looked at Jake. "Thornton." Jake's eyes moved toward him. "Chief, you look like hell." Jake's breath shook. It might have been a laugh if his body had more strength. Riley leaned closer, voice gentler now. "You're stateside. You're alive. Your parents are inbound. Your team knows." Jake's eyes slid back to Naomi. Riley followed his gaze. "He asked for her," Evelyn said quietly. Riley did not seem surprised. Jake's voice came again, almost soundless. "She saved me." Langford stepped forward. The surgical team stabilized him after a complex exploratory procedure. The sentence hit the room wrong, too clean, too quick, too desperate to own what no longer belonged only to him. Riley turned his head slowly. He looked at Langford the way experienced men looked at faulty equipment before deciding whether to repair it or throw it away. "And you are?" "Dr. Victor Langford, Chief of Surgery." Riley held his gaze. "Then I suppose you know who she is." Langford's mouth tightened. "I know her as Nurse Carter." Riley's eyes did not move. "That's your first mistake." The room went silent again. Nora Whitcomb gave a careful cough. "Master Chief Riley, perhaps we should—" "No, ma'am," Riley said, polite but immovable. "Not yet," Naomi's voice cut in. "Mason, just his first name. Quiet, warning." Riley looked at her. For a moment, the command structure reversed. The decorated man in uniform took the warning like an order. But Jake stirred on the bed. His eyes opened more fully now, dragged awake by voices in pain. "Tell them," he whispered. Naomi looked down at him. "Jake, please." There was no rank in that word, just a wounded young man asking a debt to be named. Riley's jaw shifted. He looked back at the others. "Commander Naomi Carter," he said, "was one of the finest field commanders naval special warfare ever produced." Langford's face went still. Tessa's mouth opened slightly. Evelyn did not move at all. Riley continued, voice steady but not theatrical. "She led mixed trauma response and extraction teams in places none of you will ever see on a map in a newspaper. She commanded under fire. She brought people home who had no business surviving the day. Medics, pilots, civilians, operators, kids caught in the wrong street at the wrong hour." Naomi stared at the floor. Her hands remained folded in front of her. Riley glanced at Jake. Lieutenant Thornton served under her during his first deployment attachment. Most of the young officers who worked with her learned two things fast. First, she saw what other people missed. Second, when she spoke quietly, smart people listened. Langford's eyes flickered. Ames had appeared at the doorway now, drawn by the rumor or the silence. Patel stood behind him. Dr. Marks arrived too, arms folded, her expression unreadable but alert. The recovery room had become too full. Naomi noticed every body, every witness, every exit, a habit from before. "Mason," she said again. This time there was pain in it. Riley heard it, but he had carried his own silence for years, and perhaps he was tired of the wait. "No," he said softly, "not today." Naomi looked at him then. Something passed between them that no one else could read. Old anger, old loyalty, a name on a folded flag. Riley turned back to the room. "She resigned after the Halden Ridge inquiry." Naomi's face hardened. Riley kept going. "There was an operation, bad intel, worse politics, a team pinned down, civilians in the blast radius, command back home looking for a story clean enough to survive television." The administrators shifted uncomfortably. Hospitals understood politics too. Riley's voice lowered. "Carter made the call that saved the people on the ground. It cost equipment, embarrassed senior command, and exposed failures above her pay grade. When the inquiry came, she could have protected herself by letting blame fall on her team." He looked at Jake. She didn't. Jake's eyes stayed on Naomi. Riley said she took responsibility for decisions other people forced on her. Signed papers, walked out, lost her command so younger officers and enlisted personnel wouldn't have their careers buried to protect men with cleaner hands. Naomi's voice was flat. "That's enough." Riley faced her. "No, Commander, it isn't." The old title struck harder the second time. Naomi's eyes shone for half a second before she blinked it away. Riley softened but did not retreat. "You disappeared into civilian medicine, wouldn't return calls, wouldn't appeal, wouldn't let any of us make noise." Naomi said, "Noise gets people hurt." Silence did too. That landed. Naomi looked away. Nobody in the room knew what to do with the grief that had entered. They had been prepared for a revelation, maybe even a scandal. They were not prepared for the private wreckage of honor. Evelyn stepped closer to Naomi, not touching her, but near enough to stand with her. Langford finally found his voice. "Regardless of prior service, this is a hospital. Chain of authority exists for patient safety." Dr. Marks gave a humorless laugh. "Patient safety was exactly the issue, Victor." Langford's face reddened. Nora Whitcomb turned to him. "Langford." He ignored the warning. My operative judgment, was based on the presentation available at the time. Naomi looked at him. She did not speak. That seemed to anger him more. Langford continued, a nurse with undisclosed military background, intervening physically in a surgical procedure raises serious concerns. Riley turned fully toward him. Doctor, are you suggesting the person who correctly identified the hemorrhage is the safety concern? Langford's jaw worked. I'm suggesting unauthorized interference could have killed the patient. Jake's voice rasped from the bed. But it didn't. Everyone turned. The effort of speaking had drained him. Sweat shone on his forehead. His hand trembled against the blanket. Naomi moved immediately to adjust his oxygen. Don't talk. Jake ignored her, because apparently everyone did that when dying or recovering. His eyes fixed on Langford. She saved me before, he whispered, and she saved me today. Langford said nothing. Jake's gaze drifted to the others. Listen to her. The sentence was small. It had to fight its way out of a damaged body. Still, it filled the room. Naomi placed a hand lightly on his shoulder. Enough. Jake looked up at her. For a second, he was back under her command. He obeyed. His eyes closed. The monitor settled a little. Riley watched that tiny exchange and a rough sadness crossed his face. He had seen officers demand obedience with volume and fear. Naomi had always drawn it from trust. Nora Whitcomb spoke carefully. Commander Carter. Naomi's eyes moved to her. Nurse Carter, Naomi said. The correction was gentle but firm. Whitcomb paused. Nurse Carter, I believe we need to discuss today's events formally. Evelyn's voice went sharp. Are you disciplining her? No, Whitcomb said quickly. Then after a glance at Langford, not based on what I currently understand. Langford looked offended. Dr. Marks said, good, because I'll put my statement in writing. Ames, still at the doorway, swallowed. So will I, he said. Langford turned on him. Dr. Ames. The fellow held his ground badly, but he held it. She identified the bleed, Ames said. I was there, Patel added quieter. Me too. Tessa raised her hand slightly, as if in class, then dropped it. I heard the lieutenant call her commander. No one had asked for that, but no one corrected her. Riley looked at Naomi. You never could keep people from following you. Naomi's mouth tightened. I tried. I know. That was the saddest thing he had said. The room grew quiet again. Outside, night pressed against the high windows. The city lights had come on, small and scattered, blurred by the glass. Somewhere far below, an ambulance siren rose and faded toward the emergency entrance. The hospital continued. It always did. But room 6 had changed. Everyone in it understood that the woman standing in blue scrubs by the bed was no longer invisible, whether she wanted to be or not. Langford understood it too. His authority had not vanished. He was still chief of surgery, still powerful, still dangerous in the polished, institutional way. But something had cracked around him. People had seen his certainty fail. Worse, they had seen the person he dismissed carry the truth he needed. He looked at Naomi with a new expression. Not humility, not yet. Humiliation. Those were different things. Naomi recognized the difference and did not trust it. Riley stepped beside Jake's bed. I need 5 minutes with Commander Carter, he said. Naomi said, no. It came out immediately. Riley raised an eyebrow. She clarified, I'm on duty. Evelyn folded her arms. I'll watch him. Naomi looked at her. Evelyn's expression said what words would have ruined. Let someone stand watch for you for once. Naomi looked back at Jake. His breathing had evened again. Sedation pulled him under. The lines were secure. The pressure held. For now. She nodded once. 5 minutes. Riley gestured toward the hall. Naomi followed him out. The corridor felt colder after the crowded room. A vending machine hummed beside a row of plastic chairs. Down the hall, a man in a Ravens jacket slept sitting up, chin on chest, one hand still wrapped around a foam coffee cup. Riley stopped near a window overlooking the ambulance bay. For a few seconds, neither spoke. Below them, red lights flashed as another ambulance backed into position. The sound was muted through the glass. Riley looked out at it. You look tired, he said. Naomi gave him a sideways glance. That's your opening? I had better ones on the ride over. You should have used one, he nodded. Probably. Silence. Then he said, "You saved Thornton. The surgical team saved him. Still doing that?" "What?" "Giving your victories away." Naomi's eyes remained on the ambulance below. "They're not victories." "No, they're patience." Riley breathed it out through his nose. "Same Carter." "No," she said, "not the same." He looked at her. She kept her face angled toward the glass. The same Carter would have filed a report, called command, fought the inquiry, burned down every lie they stacked in front of her. Riley's voice softened. "Why didn't you?" Naomi's reflection stared back from the window. Blue scrubs, tired eyes, badge, Nurse Carter. "Because the team was young," she said. "Because 3 of them had families. Because one mistake in a report becomes a stain no one washes off. Because the men above me had already chosen the ending." "You let them take your name." Naomi turned to him then. "No, I kept theirs clean." Riley had no answer for that. His face tightened the way men's faces do when grief gets too close to respect. "They know, Naomi." She looked away. "All of them?" she asked. "The ones who matter." Her throat moved. "Don't." "They know what you did." "Don't." He stopped. For a while, the only sound was the vending machine compressor kicking on. Then Riley reached into the inside pocket of his uniform jacket and pulled out a small object wrapped in a folded cloth. Naomi looked at it, but did not touch it. "I didn't come here for this," he said. "I was coming because Thornton was hurt, but I carry it when I travel. Habit, maybe." He unfolded the cloth. Inside was a coin, well-worn at the edges, its engraving rubbed smooth by years of hands. A command coin. On one side, an insignia. On the other, words too small for anyone else to read from a distance. Naomi recognized it immediately. Her unit coin, not the official one. The one her team had made after the worst month of their deployment. Heavy brass, imperfect. A tiny flaw on the edge where the first batch had been miscut. Riley held it out. "They wanted you to have it back." Naomi stared at the coin. Her face did not break, but something in her eyes did. "I left it on my desk." "I know. I meant to." "I know that too." She did not take it. Riley waited. Naomi's hand lifted halfway, then stopped. "I can't carry that here." "Yes, you can." "No." Her voice was low. "If I carry it, I start remembering who I was." Riley looked at her steadily. "Maybe that's the point." Naomi shook her head. "I remember enough." The words were quiet, so quiet they nearly disappeared under the hospital sounds. Riley wrapped the coin again, but did not put it away. "Command is reviewing Halden Ridge." Naomi's eyes cut to him. "What?" "New documents came up. Communications logs. Someone held them back during the inquiry." Her jaw tightened. "Who?" "You know who." She closed her eyes briefly. The men above me had already chosen the ending. Riley said, "It's moving. Slowly, ugly, but moving." Naomi opened her eyes. "And why are you telling me this?" "Because they may come for a statement." "No." "Naomi, no." Her voice had command in it now, not loud, final. Riley studied her. "You don't even know what they'll ask." "I know what institutions ask. They ask for blood and call it clarity. They're talking reinstatement." She laughed once. There was no humor in it. "Reinstatement?" "Full correction of record. Restoration of rank consideration." She looked back through the window at the ambulance bay. A crew unloaded an old man under a foil blanket. His hand hung over the side of the stretcher, fingers curled with age. "That old man down there doesn't care what rank I used to have," Naomi said. "No, Ian. He cares whether someone hears him before the machine screams." Riley said nothing. Naomi turned from the window. "I have work." Riley looked at the wrapped coin in his hand, then held it out again. "Take it anyway." This time Naomi did not refuse. She took the cloth. It fit into her palm with a weight that was far too heavy for its size. For a moment she closed her fingers around it. Then she slipped it into her scrubbed pocket. Not proudly, not ceremonially, carefully, like evidence. Riley nodded. "Thornton's team will want to know what happened. Tell them he fought. They'll ask about you." Tell them I was his nurse. Riley almost smiled. That's not a small thing. No, Naomi said, it isn't. They walked back toward room 6. At the door, Naomi paused. Through the glass, she saw Jake asleep. Evelyn sat beside him with one hand resting near the call button, guarding the room like an old lioness. Tessa stood near the counter, pretending to organize supplies while watching Naomi with open awe. Dr. Marks leaned against the wall, arms folded. Ames and Patel had retreated but not far. Langford stood apart from the others, alone in a room full of people. For the first time all day, he looked smaller than his white coat. Naomi noticed. She took no pleasure in it. Pride falling was not justice by itself. Sometimes it only made a louder crash. She opened the door. Evelyn looked up. He's resting, she said. Naomi nodded. Good. Riley stepped in behind her. Langford faced them. His voice was controlled, but tight. Nurse Carter, when you're available, administration will need your written account. I'll provide it. And I expect, he said, that it will remain factual. Naomi looked at him. The room held its breath again. It will, she said. Langford seemed prepared for argument and found none. That unsettled him more. Riley moved to Jake's bedside one last time. The lieutenant slept, unaware of the war his recognition had started around him. Riley stood over him and spoke quietly. Rest easy, son. Then he turned to Naomi. In front of everyone, he did not salute this time. He simply said, Zad, Commander. Naomi met his eyes. Nurse, she corrected. Riley nodded once. Nurse Carter. It was not a demotion when he said it. It sounded like another kind of rank. A rank earned under fluorescent lights, with steady hands and no applause. Riley left the room. The door closed behind him. For several seconds, the room remained still. Then Jake's monitor beeped. One steady note, then another. Life insisting on its plain rhythm. Naomi returned to the bedside and checked the line on his left arm. Evelyn stood beside him. You going to tell me? Evelyn asked quietly. Naomi's eyes stayed on the tubing. Probably not, Evelyn nodded. Fair. A moment passed, then Evelyn said, but for the record, I always knew you were too calm for this place. Naomi's mouth almost curved. Baltimore Mercy is not calm. No, Evelyn said, but you are. Naomi looked at Jake. His face, bruised and pale, had settled into sleep. He recognized me, she said. Evelyn's voice softened. Yes. I didn't know he was here. I didn't know it was him. I know. Naomi swallowed. If I had let them take him upstairs without following, but you didn't. The answer was firm, not comforting. Firm. Naomi looked at Evelyn then. The older nurse held her gaze with the kind of steadiness that came from 40 years of blood, grief, bad doctors, good patients, dead friends, and children born in elevators. You didn't, Evelyn repeated. Naomi nodded once. A small acceptance. Not forgiveness. Not yet. Across the room, Langford watched them. He had heard the exchange. Perhaps not every word. Enough. His face carried anger, embarrassment, calculation, and something else he would not have named. Fear, not of losing his job, not yet. Fear of being seen clearly. The door opened again. Nora Whitcomb stepped back inside, phone in hand, expression tense. Dr. Langford, as she said, Nurse Carter, we have a situation. Naomi turned. Whitcomb looked at Jake, then at the gathered staff. The hospital board has already received a call from Naval Command. Langford's expression hardened. About what? Whitcomb looked at Naomi. About Lieutenant Thornton. And about you. Naomi's hand went unconsciously to her scrub pocket, where the wrapped command coin rested against her leg. The pass had not just found her. It had entered the building, signed in at the front desk, and asked for a meeting. Jake slept through it all, breathing steadily beneath the machines. Naomi Carter stood beside him in blue scrubs, no longer invisible, not yet restored, and not remotely ready for the war that was coming next. 3 months later, winter had loosened its grip on Baltimore, but the hospital still held on to the cold. It lived in the corners, in the metal arms of waiting room chairs, in the draft that slipped under the automatic doors before sunrise, in the elevator buttons that felt like nickels against the skin. Baltimore Mercy General had survived another season of flu, falls, overdoses, heart attacks, and the ordinary bad luck of human bodies. Outside, the trees along the street had started pushing out small green buds. Inside, Trauma Bay 1 smelled exactly the same. Bleach, coffee, warmed plastic, old fear. Naomi Carter stood beside a gurney with a training mannequin on it, her sleeves pushed to her elbows, her badge hanging straight against her blue scrubs. Nurse Carter. The crack near the clip had finally been repaired. Evelyn had done it with hospital tape and then complained for 2 days that Naomi needed a new badge like a normal person. Naomi kept the old one anyway. Some things became useful because they survived. Around her stood 6 new residents, 3 nurses, 2 paramedic students, and 1 surgical fellow who had learned to keep his mouth shut until he had something worth saying. Dr. Ames stood near the foot of the bed, arms folded, listening. He did that often now. Listened. Naomi held up a marker and drew a faint line across the mannequin's right flank. "This is what people miss," she said. The room stayed quiet. No one checked a phone. No one whispered to a neighbor. No one looked bored. That was new. 3 months ago, Naomi could have said the same sentence and half the room would have waited for a doctor to repeat it before writing it down. Now the young residents watched her hands. Naomi tapped the marked spot. Visible trauma lies. Not always, but often enough to kill somebody. The obvious wound attracts attention. Your job is to respect it without becoming loyal to it. A paramedic student with a shaved head and nervous eyes raised her hand. "So if there's a penetrating wound, we still look for blunt force patterns?" "Every time," Naomi said. "Mechanism matters. Bruising matters. What the patient said before they declined matters. What the medic heard in the helicopter matters. None of it is decoration." She looked around the room. "You do not get extra time because your first theory was confident." A few people wrote that down. At the back of the room, Dr. Victor Langford stood near the glass wall, hands in the pockets of his white coat. He did not interrupt. That was new too. His hair remained silver, his shoes polished, his posture straight. But something in him had changed in the months since Jake Thornton's surgery. Not softened exactly. Men like Langford did not soften easily, but the sharpness had been filed down in places where pride had once stuck out like exposed wire. The official review had been quiet but not gentle. Statements had been taken, operative notes compared, or staff interviewed separately. The ultrasound timing questioned, the dismissal of multiple concerns documented. Langford had not been publicly disgraced because hospitals protected themselves before they protected truth. But his name no longer moved through the hallways with the same clean authority. He had kept his position. Barely, with conditions, mandatory case review participation, trauma communication retraining, peer oversight for high-risk emergency surgeries, the kind of administrative language that never sounded like punishment unless it was written about you. Naomi had not celebrated. Evelyn had. Privately, in the break room with a vending machine honey bun and the satisfied expression of a woman watching a tax bill, finally reached the right address. Naomi finished the demonstration and stepped back. "All right," she said, "you've got 90 seconds. Patient is hypotensive, tachycardic, visible left abdominal wound, right flank ecchymosis, reported shoulder pain. Walk me through your priorities." A young resident started too fast. Airway, breathing, circulation, then immediate surgical control of the penetrating. Naomi lifted one finger. He stopped. She waited. He glanced at the mannequin, then at the flank marking. "Reassess source," he said. "Good. Fast exam including right upper quadrant. Better. Alert surgery to suspected hepatic or subhepatic bleed." Naomi nodded. "And if the attending disagrees?" The resident froze. That was the real lesson. Not anatomy, courage. The room felt it. A nurse named Tessa Reed stood near the supply cart, no longer red-eyed, no longer shaking around IV pumps. She had stayed late after the Thornton case and asked Naomi if she could observe the training sessions. Naomi had said yes. Since then, Tessa had become the kind of nurse who checked the line twice and apologized less. She spoke now from the side of the room. "You keep the concern about the patient, not your ego." Naomi turned to her. "Say more." Tessa swallowed but did not retreat. "You repeat the clinical facts. Clear, specific, no drama. If they still don't listen, you escalate, you document, you get another set of eyes. But you don't go quiet just because somebody with a bigger title gets annoyed. Naomi held her gaze. Exactly. At the back, Langford shifted slightly. No one looked at him. That was mercy, or discipline. Sometimes they look similar. The training wrapped at 8:12 a.m. People filed out slowly, still talking in low voices about bruising patterns and command climate and missed injuries. Dr. Ames stayed behind to help put away supplies. Tessa walked past Naomi and touched the edge of the gurney. "I used it yesterday," she said. Naomi looked over. "What?" "The thing you said about not being loyal to the first theory." Naomi waited. Guy came in with chest pain. Everyone thought panic attack. He was loud, angry, sweating, kept saying he just needed to leave. But his daughter said he never complained, not even when he broke his ankle. So I asked for a repeat EKG. "And? Early MI. Naomi nodded once. "Good catch." Tessa tried not to smile too hard. It showed anyway. Dr. Patel said the same thing. "That's because it was." Tessa looked toward the hallway where the residents had gone. "I almost didn't say anything." Naomi's expression softened. "But you did." "Yeah." "Remember that feeling," Naomi said. "The moment before you speak. That's where people decide who they are." Tessa absorbed that quietly. Then she said, "You ever get used to it?" "No." "Great," Naomi almost smiled. "Useful things are not always comfortable." Tessa nodded and left. Ames lifted the training mannequin back onto its storage frame. "You've ruined," he said. Naomi looked at him. He raised both hands. "In a good way. They're going to question everything now." "They should. They're going to question me." "You'll survive." Ames gave a small laugh. He had become less polished since the Thornton case, and somehow better. The neat ambition was still there, but now it had bruises on it. Bruised ambition could become humility if the person let it. He glanced toward the glass wall. Langford was still there, waiting. Ames picked up the last supply bin. "I'll take this down." Naomi knew an exit when someone offered one. "Thank you." Ames left. The room emptied. Langford stepped inside. For a moment, neither of them spoke. Beyond the glass, the trauma floor moved in its morning rhythm. A patient coughed behind a curtain. A clerk argued with a printer. Evelyn's voice floated from the nurse's station, telling someone that urgent was not a magic spell and paperwork still existed. Langford looked at the marked mannequin. "You teach that well," he said. Naomi capped the marker. "It needs teaching." "Yes." The word came out stiff, but not false. He moved closer to the gurney, keeping a respectful distance. "I reviewed the case again last night." Naomi said nothing. "I do that sometimes." "I know." His eyes moved to her. She did know. Langford had been pulling the Thornton file almost weekly, not to change it, not anymore, to sit with it. That was what Evelyn had said after catching him one evening alone in the conference room. The surgical footage paused on the frame before the bleed was found. He looked like a man watching his own house burn, Evelyn had told Naomi. Naomi had said, maybe he smelled smoke. Langford touched the metal rail of the gurney. "I was wrong," he said. The words did not come easily, they had edges. Naomi waited. Langford looked at her then, not past her, not through her, at her. "I was wrong before the OR too, in the trauma bay, in the hallway, with you." The floor noise carried on outside, indifferent to a proud man learning the shape of apology. Naomi's face remained calm. Langford continued, "I confused authority with accuracy. That could have killed him." "Yes," Naomi said, "no softness, no cruelty, just the truth." Langford accepted it like a man taking a clean cut. "I have said as much to the review board. I read your addendum." His eyebrows lifted slightly. "You did?" It was factual. That almost drew a grim smile from him. He looked down. "I owe you an apology." Naomi set the marker on the tray. "You owe several people changed behavior." Langford looked up. There was a time when that sentence would have lit him up with anger. Today he nodded. "Yes." The answer surprised her more than the apology. He added, "I'd like you present for the Brenner case this afternoon." Naomi picked up the training notes. "Cardiac trauma?" "Yes, complex. I would value your assessment before we move." He said it carefully, not performative, not loud enough for witnesses. Naomi studied him. Asked Dr. Marks to review the imaging too. Already did. And Evelyn should assign trauma intake. She is. Naomi nodded. Then I'll be there. Langford gave a small, formal nod. Thank you, Nurse Carter. For once, the title did not sound like a box. It sounded like a name. He left. Naomi stood alone for a few seconds, letting the quiet settle. An apology did not repair everything. It did not erase the OR. It did not give back the moments Jake spent bleeding while pride stood in the way. It did not restore every nurse Langford had cut down over the years with a sentence disguised as a standard. But it mattered, not because he had become good, because he had become accountable. That was where repair began. Naomi cleaned the marker line from the mannequin's flank. Then her pager buzzed. She glanced down. Recovery follow-up, room 412, Jake Thornton. She left the training room and took the stairs. By habit, not necessity. The stairwell smelled like dust, old paint, and warm pipes. Her shoes echoed on concrete. On the second landing, someone had taped a flyer for a hospital blood drive. On the third, a janitor had left a mop bucket beside the rail. Ordinary things, honest things. Naomi liked stairwells. Nobody performed in them. Room 412 faced east. Morning light came through the window and landed across the bed in a pale rectangle. Jake Thornton sat propped against pillows, thinner than he had been 3 months ago, but alive in a way that filled the room more than his injuries did. His hair had grown out slightly. A faint scar crossed his left temple. His right arm rested in a sling from secondary repairs, and beneath the collar of his t-shirt, the edge of a surgical scar disappeared under fabric. He had a deck of cards spread across his blanket. Evelyn sat in the visitor chair, losing badly and pretending not to care. "You're cheating," Evelyn said. Jake smiled. "Ma'am, I'm recovering from traumatic injury. That doesn't answer the charge." "It was meant to distract from it." Naomi stepped in. Jake looked up. The smile faded into something quieter. "Commander?" Naomi gave him the same look she had given him every time he used the word. "Nurse," he corrected himself with a small nod. "Nurse Carter." Evelyn stood, collecting her coffee. "Good. You're here. He's been impossible." Jake said, "She threatened to smother me with a pillow." "I said I understood the impulse," Evelyn replied. "Different thing." She passed Naomi at the door and lowered her voice. "He's nervous." Naomi glanced at Jake. He was pretending to sort cards. "I know." Evelyn left them. Naomi checked the chart first because routine gave dignity to moments that might otherwise become too emotional. Pain? Manageable. That's not a number. 4. Actual 4 or soldier 4? He looked offended. "There's a difference?" "Yes, soldier 4 means 7. He sighed. "He's 6. Naomi adjusted the note. "Better." Jake watched her. "They said I'm going to rehab next week." "That's the plan." "They said I might get most of my strength back." "That's also the plan." "Plans change." Naomi looked at him. "Yes." He stared at the cards. His thumb rubbed the corner of the ace of spades until it bent slightly. "I don't remember all of it," he said. "You don't need to." "I remember the elevator." Naomi stayed still. "I remember you standing outside when the doors closed. I thought..." He stopped, swallowed. "I thought I was back there." Naomi pulled the chair closer but did not sit yet. Jake continued. "I heard Langford. I heard the monitor. I couldn't make words work. But I knew my right side was wrong. I knew you knew." Naomi sat, the chair creaked beneath her. Jake looked at her with the stripped honesty of someone who had been too close to death to waste energy on pride. "You followed." "Yes." "Why?" Naomi could have said because it was her job. That would have been true. Incomplete, but true. Instead, she said, "Because you asked me not to let go." His eyes lowered. "I did?" "Not with words." Jake nodded slowly. A long, quiet passed. Then he said, "Chief Riley told me about the review, about Halden Ridge." Naomi's jaw tightened. "He talks too much." "He said you'd say that." "He also predicts weather by complaining about his knees." Jake smiled faintly, then grew serious. "They're clearing your record." Naomi looked toward the window. Outside, the city was bright with spring beginning badly and honestly. Sirens moved somewhere far away. A bus hissed at the curb below. An old man in a wool cap waited at the crosswalk with a grocery bag in each hand. Jake said, "They should." Naomi's voice was quiet. "Should doesn't undo." "No," he turned the bank card in his fingers, "but it says the lie doesn't get the last word." That struck deeper than he meant it to. Naomi looked back at him. Jake's eyes were tired but steady. "You taught us that," he said. "I taught you trauma response." "No," his voice was soft. "You taught us not to leave people behind, including ourselves." Naomi could not answer that right away. The door opened before she had to. Mason Riley stepped in wearing civilian clothes for once. Dark jacket, collared shirt, jeans, boots polished anyway because some habits never retired. Behind him came Nora Whitcomb, Dr. Marks, and an older man Naomi had seen only once before on a secure video call years ago, Admiral Thomas Greer, retired now officially, but not diminished. Men like him carried rank in the way they entered a room. Naomi stood. Jake tried to sit straighter and winced. Riley pointed at him. "Don't be stupid." Jake eased back. "Yes, Chief." Greer's eyes moved to Naomi. "Miss Carter." "Nurse Carter." "Behind me," she said. A flicker of respect crossed his face. "Nurse Carter." He held a folder in both hands. Not thick, not dramatic, just a folder. The kind institutions used when they wanted paper to carry what people should have said out loud years ago. Greer glanced at Jake, then back to Naomi. "May we speak privately?" Naomi looked at Jake. Jake held up both hands as much as his injuries allowed. "I'm sedated and trustworthy." "No," Naomi said. Riley snorted. Whitcomb offered, "We can use the family consultation room." Naomi nodded. In the consultation room, the furniture was too soft and the lighting too yellow. A box of tissues sat on a low table beside old magazines no one ever read. Hospitals built rooms like this for bad news and then wondered why they always felt haunted. Naomi remained standing. So did Riley. Greer opened the folder. "I'll be brief," he said. "The department review of the Halden Ridge operation has concluded its primary findings." Naomi said nothing. Greer removed a single page. The inquiry determined that critical communications logs were withheld from the original investigation. Those logs confirmed that you acted within emergency authority and that your decisions prevented greater loss of life. The room was silent. Naomi heard the HVAC click on. Greer continued, "The adverse findings against you are being vacated. Your service record will be corrected. Your commendations restored. Your resignation status is being reviewed for conversion." Riley watched her carefully. Naomi's face stayed composed. Inside, something old shifted but did not break. Greer closed the folder halfway. "There is more." Of course there was. "The Navy is prepared to offer reinstatement at the rank of captain, pending medical and administrative review. You would not return to field command immediately. We would want you in training, doctrine, trauma systems integration. Your experience could reshape how military and civilian teams communicate under pressure." Riley added, "You'd teach, build programs, make sure what happened to Thornton doesn't happen to the next kid." Naomi looked at the folder. Captain. The word should have done something. Once maybe it would have. There had been a time when rank meant responsibility, not vanity, a visible promise, a burden accepted in public, a way to stand between power and the people it used. But she thought of the trauma floor downstairs. Tessa saying she almost stayed quiet. Ames learning to listen. Evelyn guarding rooms like a sentinel. Harold Finch's wife pressing her face into a worn purse. Jake's cold fingers catching hers before the elevator doors closed. She thought of the old man at the crosswalk below. He would never know what Halden Ridge was. He would never know what had been taken from her or offered back. If he came through the doors gasping for breath, all he would know was whether someone saw him in time. Greer waited. Naomi touched the edge of the chair but did not sit. "I'm grateful the record is being corrected," she said. Riley's eyes narrowed slightly. He knew that tone. Greer did too. Naomi continued, "And I'm grateful for the offer." "But," Riley said. Naomi looked at him. "But I'm staying here." The words were quiet. No one interrupted. She turned to Greer. I spent a long time thinking I lost my command. Maybe I did. Maybe that's what the paperwork says, but command was never the uniform. It was never the title. It was the obligation to see clearly when other people looked away. Her voice remained steady. I can do that here. Greer studied her. You understand the significance of what you're declining? Yes. Captain Carter would carry weight. Naomi nodded. So does Nurse Carter. Riley looked down at the floor, smiling a little despite himself. Greer closed the folder fully. May I ask why? Naomi looked through the small interior window toward the hallway, where a young nurse walked beside an elderly patient pushing an IV pump. The patient moved slowly, one slipper dragging. The nurse did not rush him. This hospital needs a different kind of chain of command, Naomi said. One where the newest nurse can say what she sees, where medics are heard, where surgeons know authority is not proof, where patients don't die because the truth came from the wrong badge. Whitcomb, who had been quiet until then, straightened. We'd like you to build that program here, she said. Naomi turned to her. Not as a committee title. No, Whitcomb said. As authority. Naomi waited. Whitcomb chose her words carefully. Director of Trauma Response Training, reporting jointly to surgery and emergency medicine. Curriculum authority, case review participation, interdisciplinary simulation, staff escalation protocols. Riley gave Naomi a sideways look. That sounds like command to me. Naomi ignored him. Whitcomb added, and I would like you to help rewrite our speaking up policy. Naomi's eyes sharpened. Policy doesn't help if people are punished for using it. Then we build protection into it. Real protection? Whitcomb nodded. Real. Naomi studied her long enough to make the administrator uncomfortable. Then yes, Naomi said. Riley breathed out softly. Greer extended his hand. Naomi shook it. His grip was firm, weathered, and respectful. For what it's worth, Greer said, I'm sorry it took this long. Naomi held his gaze. It should be worth more than words. Greer nodded once. It will be. That was not enough, but it was a start. That afternoon, Dr. Langford did not begin the Brenner operation until Naomi finished her assessment. He stood beside the imaging screen while she pointed out the injury pattern, the likely complications, the questions still unanswered. Dr. Marks leaned against the counter. Ames took notes. Patel asked a good question and looked relieved when no one mocked him for it. Langford listened. When Naomi finished, he said, Anything else? Naomi looked at the scan again. No, Langford nodded. Then we proceed. He turned to the team. Everyone in this room speaks up if something does not fit. I don't care whose name is on the coat. Clear? The room answered, Clear. Naomi watched him for a second. He did not look at her for approval. That was good. Change behavior did not need applause. It needed repetition. Weeks passed. Spring entered Baltimore in pieces. Rain on ambulance windshields, daffodils beside the parking garage, warmer air that made the emergency entrance smell briefly of wet concrete instead of road salt. The training program began in a basement classroom with unreliable heat and a projector that turned every image faintly green. Naomi taught the first session with Evelyn in the back row and Tessa up front. By the third week, paramedics were attending. By the sixth, surgery residents. By the eighth, Langford himself sat through the entire session on communication failure and did not say one defensive word. Jake visited once after discharge, walking slowly with a cane, his parents on either side of him as if they were afraid the world might take him back. His mother hugged Naomi without asking permission and cried into her shoulder. His father shook Naomi's hand with both of his and said nothing for several seconds. Then he managed, Thank you for bringing my boy home. Naomi answered, He did the hard part. His father looked toward Jake. He always did hate asking for help. So do most soldiers, Naomi said. Jake heard her and smiled. So do most commanders. Naomi gave him a look. He corrected himself. Nurses. Evelyn laughed so hard she had to sit down. On the final day of the first training cycle, Naomi stood again in Trauma Bay 1. This time the room was full beyond capacity. Nurses, residents, medics, administrators, techs, 2 surgeons from another hospital, and a custodian who had slipped in during lunch because Evelyn told him he had better instincts than half the interns. Naomi did not use a slideshow. She stood beside the bed where Jake Thornton had first been placed 3 months earlier. The mattress was clean now. Fresh sheets, new straps, no blood, no torn uniform, no visible memory of the day a young man almost vanished under bright lights and professional pride. But Naomi remembered. So did the room. She placed one hand on the rail. "This bed does not care what title you carry," she said. The room stilled. "It does not care how long you trained, how many letters follow your name, how many missions you survived, how many papers you published, or how many times you were right before." She looked from face to face. When someone is dying, the only thing that matters is whether the truth can reach the person with the power to act. Langford stood near the back, Evelyn beside him. Neither moved. Naomi continued, "Sometimes that truth comes from a scan, sometimes from a lab, sometimes from a medic who heard 3 words in a helicopter, sometimes from a nurse who saw a bruise, sometimes from a patient who can barely whisper." Her voice lowered. "Your job is to make sure the room is never too proud to hear it." No one wrote, they listened. Naomi touched her scrub pocket. Inside was the old command coin, wrapped in cloth. She carried it now. Not every day, but today. She had learned that remembering who she had been did not erase who she had chosen to become. The 2 lives did not need to fight. They could stand watch together. After the session, people left slowly. Conversations stayed quiet, thoughtful. Evelyn collected empty coffee cups with the irritated tenderness of someone who had fed an army and resented the crumbs. Langford approached Naomi once the room had thinned. "Strong session," he said. "Thank you." He hesitated, then said, "The Brenner case went well." "I heard. Your pre-op concern about venous injury was correct. I'm glad they controlled it." He nodded, a pause. Then with effort but less pain than before, Langford said, "I'm glad you were there." Naomi met his eyes. "So am I." That was all. It was enough. At dusk, Naomi walked out through the ambulance bay instead of the main entrance. The sky over Baltimore was bruised purple and orange, the kind of evening that made brick buildings look older than they were. A bus sighed at the curb. Somewhere in the distance, a siren rose, turned a corner, and faded. She stood for a moment in the cool air. Evelyn came out behind her, pulling on a cardigan. "You planning to stand there like a movie ending?" Evelyn asked. Naomi looked over. "Maybe." "Try not to look too noble. People will ask you for donations." Naomi almost smiled. They stood together while an ambulance backed into the bay. The doors opened. 2 medics climbed out with an elderly man wrapped in a blanket, his weathered hand hanging over the stretcher rail. Naomi stepped forward without thinking, then stopped. The receiving team had him. Tessa was already there, hand on the patient's shoulder, asking the right questions in the right voice. A resident listened to the medic without interrupting. Ames stood nearby, watching the patient instead of the clock. Naomi stayed back, Evelyn noticed. "Hard part?" Evelyn asked. "What?" "Teaching people well enough that they don't need you every second." Naomi watched Tessa catch a change in the old man's breathing and immediately call for oxygen. "No," Naomi said, "that's the point." Evelyn nodded. The stretcher rolled inside, the doors closed. Naomi turned toward the parking lot. Her badge caught the last light. Nurse Carter, in her pocket, the old coin pressed against her leg. Commander Carter. Both true, neither complete. She walked toward her car under a sky slowly filling with night, carrying no visible rank, no polished shoes, no white coat, no need to be announced before entering a room. Only the thing that had outlasted every title she had lost and every title she had refused. Integrity, the only rank that mattered. And somewhere behind her, inside Baltimore Mercy General, another young nurse spoke up before a machine had to scream. Integrity is the only rank that matters. Never judge a person by the uniform they wear today, for you know nothing of the battle they won yesterday.
Wasn't that a mysterious ending? I'd love to hear your opinion in the comment section. I appreciate you spending your time with me today. Don't forget to hit the subscribe button for your daily dose of stories. See you in the next one. Thanks for watching.